For the record, my name is Henry Santana, City Councilor at Large, and I am the Chair of the Boston City Council Committee on Public Safety and Criminal Justice. Today is October 22, 2024. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, Files Channel 964. Written comments may be sent to the committee email at ccc.ps@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of this hearing. Individuals will be called on in the order in which they signed up and will have 2 minutes to testify. If you are looking to testify in person, please add your name to the sign-up sheet near the entrance. If you are looking to testify virtually, please email our Central Staff Liaison, Ron Cobb, at ron.cobb@boston.gov for the link, and your name will be added to the list. Today's hearing is on docket number 1205, order for a hearing to discuss ways to provide critical public safety support and address quality of life issues relating to the crisis at Mass and Cass. This matter was sponsored by Councilors Ed Flynn, Tanya Fernandez-Anderson, and Henry Santana, and was referred to the committee on August 7, 2024. Today, I am joined by my colleagues in order of arrival. Councilor Ed Flynn from District 2, who's the lead co-sponsor, Councilor Fernandez-Anderson from District 7, who is a co-sponsor. We also received a letter of absence from Councilor Enrique Pepen and from Councilor Brian Morrell. Before we begin, I'd like to just ask folks to please silence their phones and devices. We have a lot of panelists and public testimony to hear today, so in the interest of providing all of my colleagues more time for questions and discussion, I'd like to offer the lead sponsor and original co-sponsor to share opening remarks, and then we will proceed with our first panel. Councilor Ed Flynn, you have the floor.
Thank you, Mr. Chair. Thank you for holding this important hearing. I'd also like to thank Councilor Fernandez-Anderson for co-sponsoring this with me. I'd also like to recognize Councilor John Fitzgerald for his leadership and work in this area as well, including City Councilor Frank Baker, previous to Councilor Fitzgerald. With the closure of the Long Island Bridge and treatment facility in 2014, the opioid crisis spread to Melnia, Cass, and surrounding neighborhoods, including Andrews Square in South Boston, the South End, Nubian Square, in Roxbury, Boston Common, Downtown Crossing, Dorchester as well, Copley Square. These issues have continued in surrounding areas that I highlighted and across the city after the removal of the tents last year, which occurred due to the open drug dealing, drug use, violence, sexual assaults, trafficking of women. I continue to hear from many who live and work in Andrews Square, in the South End, in Dorchester, downtown Boston, Beacon Hill, Back Bay, about open drug markets happening in many places across the city. To be candid, and there's public here as well, many parents have said to me they don't feel safe here, especially with their children. Their quality of life has declined significantly. We also have seniors here as well that will testify. They don't feel safe. I met with residents, I met with parents taking their little kids to school, walking through the South End, walking through Roxbury, walking through Dorchester, or Copley Square, or Beacon Hill. They don't feel safe. I served as a probation officer and worked with many individuals to get them into recovery services at Long Island. I understand how critical it is that we get people with substance use issues into treatment that they need. At the same time, it is important that our city demonstrates that we are serious in maintaining a zero-tolerance policy moving forward when it comes to public safety issues. I continue to advocate for the arrest of individuals committing illegal acts of violence, those engaged in drug, gun trafficking, individuals assaulting others. We must ensure that all of our residents and businesses in the impacted neighborhoods feel safe and their quality of life is respected. We also have in this audience here well-respected coaches, youth coaches that are mentoring kids, teaching them how to play baseball, teaching them how to play football. They can't use some of these parks because these parks, unfortunately, are spread with needles. The ongoing humanitarian crisis at Mass and Cass is both a public safety and public health crisis. It requires the resources at the city, state, and federal level. We need federal involvement in law enforcement in and around Mass and Cass. Drug dealing, violence, other illegal activities must be removed from public spaces. Zero tolerance. At the same time, we need a coordinated response with city and state to address the issues of homelessness and addiction. We need to move forward with a better plan, a new plan, a treatment-first approach to help put those suffering from addiction on the road to recovery. They need drug treatment services. They work. Allowing people to be on Mass and Cass is not an effective strategy. It is critical that we continue working with our public health and street outreach teams to admit vulnerable communities into detox, followed by drug treatment and care. They may not want to go in there, but being in a drug treatment program is the best thing for them. The current situation at Mass and Cass and the impacted communities that I have highlighted continues to harm residents, small businesses, nonprofits, our economy. At the same time, the status quo is not an option. We must provide positive leadership to improve this emergency, this crisis. At today's hearing, we have invited many of our experts, including city partners, nonprofit, businesses, residents, who have different experiences in managing the spillover at Mass and Cass. I hope that by working together, we can share ideas, effectively identify and improve upon the public safety and quality of life surrounding these communities. We need a comprehensive approach that involves all stakeholders, and we don't have that right now. I think we all admit that there is not a long-term plan on how to deal with public safety and how to deal with getting people into drug treatment programs. This has escalated. Even when the tents were removed, the problem remained. The problem was spread out, not just to Mass and Cass, but other areas that I have highlighted. It's okay to admit failure, but let's admit failure and move forward with a comprehensive plan that works for residents, that works for the businesses, that works for people suffering from drug, substance use-related issues, and provide the critical leadership that is needed. Even though it may be unpopular, even though it may be politically unpopular, we have to do what we believe is right. Thank you, Mr. Chair.
Thank you, Councilor Flynn. Councilor Fernandez-Anderson, you have the floor.
Thank you so much, Mr. Chair. Good morning to all the panelists and to the community members who are here. We hope to get to this conversation in a timely fashion so that we don't make you wait. We know that those chairs are super uncomfortable. Just a tip, the chairs to the right are more comfortable than the ones that you're sitting at right now. And we all agree that this is a huge problem with, multifaceted issues or intersectionalities that we differ on how to address. So I am very excited for this conversation. Mr. Chair, thank you so much for working with my office and, of course, the lead sponsor to holding this conversation. And I do believe that it's going to take a collective collaboration between the council, the administration, the community, those unhoused, all people impacted, to be able to actually properly assess it. I think one of the biggest issues is fiscal lack of money to really invest in the way that we know that best practices have shown us that can actually effectively address this issue. But today I'm very interested in framing this conversation in a way where we sort of assess the current situation, how it's escalated, how it's trickled down to our neighborhoods, Nubian Square, all parts of Roxbury at this point, as well as the services that are going into the task force, partnership or collaborations with Newmarket Square, other types of work programs such as Newmarket Square's work program, but as well as sort of assessing all of the different services and how we're building continuity of service to be able to actually execute wraparound services. Is that working? Is that not working? I have a lot of questions about data in terms of those impacted around Nubian Square, and I hope that we can both appreciate each other's feedback here and we can get closer to the solution. Thank you so much.
Thank you, Councilor Fernandez-Anderson, and thank you to my colleagues. At this time, I'd like to provide an overview of the panelists the committee invited to testify on behalf of the administration. Deputy Superintendent Dan Humphreys, who's the Bureau of Field Services with Boston Police Department. Kelly Young, the Director of the Coordinated Response Team. Dr. Bisola Ojikutu, Commissioner of the Public Health and Executive Director of the Boston Public Health Commission, and Yailka Caldenas, Interim Director of the Bureau of Recovery Services. For the panelists who are here today, I'd like to ask each of you to just state your name for the record, and then please proceed with your opening remarks. I just kindly ask that in order to allow time for councilors' questions and discussion, that you please limit your opening statements to 5 minutes per panelist. Thank you so much. You can go in any order you'd like.
Sure. Good morning. Dan Humphreys. I'm a Deputy Superintendent. It's my pleasure to serve as the Assistant Chief of Bureau of Field Services. And like the times we've been here before, hope I can answer any questions, and I'll keep my comments brief so we can get right into it. But I'm ready to answer any questions you have. And I feel like the key to success here is communication, openness, transparency, and just building trust with the community.
Thank you.
Hi, I'm Kelly Young, and I'm the new director for the Coordinated Response Team. I come to the city with 25 years of experience in social services. The bulk of that time has been spent in the field, hands-on experience. So although I am new to this role, I am certainly not new to addressing these challenges in our city. So, thank you.
Great. Good morning. Can everyone hear me?
Yep.
Okay. So good morning, everyone. For the record, my name is Dr. Bisola Ojikutu, and as mentioned, I'm the Commissioner of Public Health for the City of Boston. I'm joined here by my colleague. I'm really happy that she's joining us today. She's the Interim Director of the Recovery Services Bureau at the Boston Public Health Commission. Thank you all for bringing this issue to the fore. We look forward to this conversation, and I'll hold my comments as we kind of go back through to make our opening statements.
Hi, good morning. Like you already mentioned, my name is Shaika Cardenas. I am the Interim Bureau Director for Recovery Services, and I have been working for the Boston Public Health Commission for close to 14 years.
Great. Well, thank you so much for our panelists to be here. If you have any opening statements or presentations that you want to display, this will be your time.
Do you all have opening statements? No. No. Okay, so I do have an opening statement just to give you all a sense of what's happening from a public health perspective. So again, thank you, Councilor Flynn, Councilor Fernandez-Anderson, and Chair Santana for holding this hearing today. Over the past year, since the removal of the encampment on Atkinson Street in November of 2023, we have made progress by sustaining a public health informed response to homelessness and substance use disorder. I want to emphasize that we're not just working in the Mass and Cass area, we're really working citywide, and I'll talk a little bit about some of our citywide efforts in partnership with my colleagues here from the Boston Police Department, from the Coordinated Response Team, and many other agencies and partners. just to give you a sense of that progress, overdose deaths are actually down if you compare this year to last year. And I think that's an important piece of the puzzle here, that we have people who are dying, and we certainly had an increase in overdose deaths. And there is less visible crowding. But I want to acknowledge that the resident concerns that we have heard and we will hear more about today are very real, and many challenges remain, and we are looking forward to hearing more about and working together with you to address those challenges. Just to say a little bit about the public health approach, it's really about making Boston a better place to live for everyone, but it certainly requires both a short-term and a long-term vision. The short-term is that those working alongside coordinated response and BPD and our Recovery Service Bureau are certainly putting people and giving them access to treatment, services, transitional spaces, and shelter. But we have to think long-term. We have a system that's broken for people who are living with substance use disorder. And I think that what we need is a much stronger continuum of care for individuals who are living with substance use disorder and who are unsheltered. And that would solve a lot of the problems that we're facing. I just want to say a few words again about our public health approach and a few updates in regards to the Mass and Cass area. I mentioned already that there's less visible crowding in the area. With that decrease in visible crowding, our outreach workers have moved to a citywide approach. Again, we're focused in on regular routes and responding to urgent situations around the city. It's important for you as city councilors to know that we have these two shelters in the Mass and Cass area, which are the largest adult shelters in the entire region, and we are supporting that as a city, 112 and Woods Mullen. Those shelters are at capacity. Those shelters are housing numerous people who are living with substance use disorder. On a nightly basis, we shelter more than 600 individuals, and some of that capacity has, increased, or the number of people who we're sheltering is increased because of recent migrant arrivals. This is a challenge for us because these are oftentimes people who spill over into the Mass and Cass area, into the connector, and into the neighborhoods. I also want to mention that the engagement center is still closed. It was an important resource. It's still an important resource because we're using it for overflow for people who were receiving services and shelter in 112. They're, now some of them are now sleeping in the engagement center. Since Councilor Fernandez-Anderson mentioned Nubian Square, again, I want to emphasize that we're working in multiple areas around the city, not just in Mass and Cass, and I think that there is an example in Nubian Square with the Nubian Square Task Force that needs to be highlighted. We know that it has arisen as an area of concern with increased congregation of individuals living with substance use disorder and open drug use. So the Boston Public Health Commission co-leads the Nubian Square Task Force. It's focused on outreach, treatment navigation, overdose prevention, decreasing substance use stigma, and really thinking about the stakeholders in the area and what role they have to play in this whole process. And I think that that's really important. We've brought together more than 20 different stakeholders. I think we need more capacity on the ground. So one of the things that we've done is we've funded a number of community-based organizations recently, Metro Boston Live, Torchlight Recovery, Community Care Clinic, Harvard Street, other folks who are doing healthcare services in the area, and really trying to coordinate that response in a better way, in a way that not only shows that we are interested in what's happening in Mass and Cass, but we're interested in what's happening around our city so that we can take care of all of our residents. I also want to mention our low threshold shelter program because I think it is a great success story that has actually been told nationally. BPHC, the city, the coordinated response team, and other community partners really work extensively to place people with substance use disorder in low threshold spaces. Over the past year, as you know, we had 727, which was a space. We ended up closing that because it was meant to be temporary, but we've continued to support and will continue to build support with the Envision Hotel, Woods Mullen, the Friends Floor, Pine Street Shelter, and we have about 180 beds at this time that we'll continue to support. I know that one of the major issues is syringe services and needle pickup. Again, I think that we are working very hard to meet the needs of our city. Though the community syringe redemption program ended, we have multiple strategies used to pick up needles around the city, including AHOPE, our sharp disposal kiosks, our outreach teams, our mobile sharps team, and our expanded New Market partnership. Just to say two things about those particular strategies. So our fully staffed mobile Sharps team picks up both Sharps and paraphernalia around the city responding to 311 calls. I think we're all very proud to say as a city that we rapidly respond to 311 requests for Sharps pickup with a median response time of 45 minutes. I think that that really should be recognized, and I'm very proud of our team and our ability to do that. Secondly, we're very proud of our partnership with Sue Sullivan in regards to the New Market Back to Work crew, which is an extraordinary group of individuals who are now expanded their work into Andrew Square, South End, Worcester Square, Nubian Square, and other places around the city. And that's, effort that really is a 7-day-a-week initiative. So lastly, I just want to say that oftentimes we don't thank the people on the ground, the boots on the ground who are doing the work, and a lot of this is happening through our outreach teams. I want to give a special shout out to Recovery Services and our homeless services staff for manning these shelters that I mentioned. That is very complicated work, very difficult, tough jobs, and I hope that we can all sort of join together and thank them for their commitment and dedication to the City of Boston. So thank you, and I'm happy to take any questions, as is Director Cardenas.
Thank you so much, Commissioner. Is that?
I would like to just piggyback, if that's okay.
Absolutely. Thank you.
So, since I have become the director of the coordinated response team, I have directed our outreach liaisons to visit Nubian Square and Grove Hall 5 nights a week. And through that initiative, the past 3 weeks, we have been successful in connecting 12 people to services, and we were able to disassemble and clean 3 encampments in just those 2 areas. I believe that law enforcement is the best deterrent, and I am expanding our team. They will be receiving diversion and deflection training so we can successfully partner with the Boston Police. Law enforcement will help us to provide the necessary care and increase the likelihood of a person's participation in a treatment plan, along with services without sentences. So I just wanted to let you know some of the changes that are currently happening. And Mayor Wu has challenged us to identify and implement strategies to motivate disengaged substance users and congregate outdoor use. So we are currently working on those strategies and implementing them.
Awesome. Thank you so much. Are we all set with the? Okay, great. Before I just turn it over to my colleagues for questions, I just do want to double down on something the Commissioner mentioned. Is I had the opportunity to a few weeks ago to tour Masking Cast with a coordinated response team. I also had the opportunity to have a walkthrough with my colleague Tanya Fernandez Anderson around Nubian Square and see those impacts. So we know there's work being done. I do want to double down on the incredible work being done by the people on the ground. But I think this conversation also, there's a lot still going on. We're hearing from community members, from residents, of what's going on. So hopefully we can answer some questions from my colleagues here and see what other approaches we can be taking. So with that, I would like to turn it over to Councillor Flynn for your opening questions. Oh, sorry. I also want to acknowledge that we've been joined by Councillor at Large, Councillor Mejia. Thank you for being here. Councillor Flynn.
Thank you. Thank you, Mr. Chair. And I do know, Dr. Ojukutu, I know you mentioned that it's improving over Mass and Cass, and people are not congregating there. But I spent a lot of time this summer, especially on Melnia Cass, and throughout the summer, there was hundreds and hundreds of people every day in and around Melnia Cass. I talked to Superintendent Cullinane several times about this, and eventually they put up those structures so people couldn't literally stand or sit on the sidewalk.
Domestic gas folks, not on a daily basis, but something that the city probably needs to do.
Sorry. We're in a brief freeze.
I'm just reading a Boston Globe article, June 14, 2024. Opiate deaths in Boston rose last year despite a statewide decline. Amid the encouraging decline in opiate-related deaths across Massachusetts in 2023, there was one significant exception, the city of Boston, which recorded the highest number of deaths in 7 years, according to newly released state data. It's not a criticism of anybody. But we also have to acknowledge that it's reality. And these aren't what's happening in Mass and Cass or the South End and Roxbury and Dorchester. It's happening. It's spread out. It's happening across the city. Beacon Hill is impacted. The Boston Common is impacted. Andrew Square, where I live, also is seeing significant public safety related issues, ongoing drug dealing activity, needles being discarded recklessly. So, Dr. Ojakuta, my question is, just reading studies from across the country, it seems like experts in the field of recovery are now moving away from safe injection sites to getting people more into drug treatment programs, even in Canada, where it's a very progressive country rather. Harm reduction, intervention, and services, they have shifted their focus to recovery, treatment-first initiatives and approaches. Is that where the City of Boston Public Health Commission is going, or what's the direction of the Public Health Commission?
Thank you so much, Councilor Flynn, for your comments. Before I get to that question, if I could go back to the data, because I think that you spoke to a very important data point. That was very concerning, that the state actually had a decrease in overdose deaths from 2022 to 2023. Whereas we had an increase of 12%, where they had a decrease of 10%. What I was referring to is, because we are so focused on this issue of overdoses, we actually looked at our data from January to April of this year and compared it to last year, so we can get updated data, so we can tell you what's happening right now. And actually, we saw a 33% decrease in overdoses during that time across the city of Boston, with a more than 50% decrease in particular populations, Black and Latinx individuals. So that data is delayed, the data that you read and that we talked about with the media. So I just wanted to let you know.
So your data was over the last 6 or 7 months?
Exactly.
Okay.
Yeah.
The data I had was what happened over the last 6 or 7 years, I believe.
It's older data, so yes.
Yeah, up to the present, though.
Yeah.
So over the last 6 or 7 years, although deaths have declined in Massachusetts, overdose deaths have declined in Massachusetts, they have gone up in the city of Boston.
Well, so that went through 2003. So we are talking about 2004. So the most recent data is that overdoses have declined. And that's actually a national trend.
Yeah.
It's a good thing that we're doing the work, things are happening. But I just wanted to get to your question about...
No, I know, but I do want to say that overdose deaths have increased in Boston while they decreased across Massachusetts. That's so we can respect the stats and try to make changes to it, but we have to acknowledge that those are accurate stats.
It was very concerning, as you said,
right,
very
okay.
concerning. But we're staying on top of the data, and we'll get more data to you as we follow it up every single month. In regards to our strategy, the approach that we've taken is that there isn't one answer, and there isn't one answer for any group of individuals. So certainly, we support and encourage recovery. We have recovery pathways that I'm going to let Director Cardenas talk about. We also understand that there's some people who are suffering from chronic substance use disorder and who are challenged when they get into detox, and then following from detox when they don't necessarily have a place to go after detox. As I mentioned, there are problems in our system. There's a trajectory that isn't really as strong as it should be. These are things that we are certainly working on. So our strategy is to meet people where they're at, to offer them the services that are available, and to understand that everybody's journey is not going to be the same. So all options are on the table. Jaika, do you want to say a few words? Yeah.
Can you hear me? Okay. So I can tell you a little bit about our PASS program. So our PASS program is a one-stop shop. It's an access to care program where individuals, including family members, can walk in, can call, can access whatever level of care they think they meet criteria for. When they walk into our center, although sometimes they're looking for a detox, or maybe someone like BPD or another member in the community maybe is suggesting they go to detox, we do assess them, we screen them, make sure that they meet criteria for that level of care. And if they don't meet criteria, we look for the next level of care. Within recovery services, we have a range of services. We have an entire residential level of care in Mattapan, which is our third campus. And we have a program there for women and children who identify with a substance use disorder. They can go there up to 1 year. So it's a 6 to 12-month program for women and their children. And then down the hill, we have our transitions program, which is a transitional program. So it's a post-detox program for men and women. We have up to 60 beds there that we work with individuals not only to stabilize them post-detox, but we can also help them get into long-term residential treatment. In addition to that, our outreach workers, our red shirts, they're out in the community. They cover throughout, Dr. O mentioned, we are looking to expand some of the areas that they cover. And when they engage with individuals, we also work with neighborhood hospitals, health centers. We have partnerships with local medication-assisted treatment programs or centers that offer medication for opioid use disorder. So we currently have a partnership where one of those programs offer services at our Finland, which is one of our campuses across from Boston Medical Center. And at that center, we work with individuals not only to start them on medications, if that's the form of treatment they're looking for, but we also connect them to other things like outpatient treatment, counseling, and medical services. And so for us, right, dependent on the level of care the person's looking for, we also work with partners, and so we are looking to expand the continuum and the collaboration we have across the city. We are looking, so monthly, someone from my office, and it's usually myself as well as one of the deputy commissioners, we meet with the state as well monthly, and we troubleshoot, we coordinate, we talk a lot around what can be improved, and we also look for ways to formulate new relationships and partnership. So we are aware, right, that there's a lot more work that we could be doing, but I do feel that we are moving in that direction to collaborate and talk around what's working and bring new partners to the table, especially if they're looking for a different level that we don't offer.
Thank you, Councilor Flynn. Councilor Fernandez-Anderson, you have the floor.
Thank you, Mr. Chair. Dr. Jakutu, I'm really interested in understanding, like, your public health, long-term public health strategic outlook, and understanding where you are on things, and if you've found barriers along the way with the short term as well as thinking, moving or transitioning into the long-term strategies?
I think that, yes, we, like every city, is challenged by that long-term piece. I think it, as JICA Director Cardenas mentioned, we have success in referring people to detox, and there are many people who are going into detox, but it's what happens next that isn't always so clear and isn't always so standardized, meaning that everybody's getting, access to all the services that we believe that they should. I think one of the areas that I want to speak to that I think talks about the continuum and what we're doing and what we're trying to do differently is thinking about our low threshold sheltering program, because we have people who are on the street who are referred into low threshold housing where they can actually get access to services. And the goal there is then to hopefully get them to permanent supportive housing, get them to places where they can go and then do more work and get back involved in life. And we have been successful in that. So if you look at the number of people who we currently have housed in our low threshold spaces, 52 of them, so almost half of them, are actually on the path to getting permanent supportive housing. So they have a housing resource in hand. But again, if you look at low threshold shelters and those spaces, it's expensive. And we're working to make that available to more people. And we're working to get people, interested in that pathway, because it is a change for folks to go into a system where, they're being offered, services, even though they can still, because it's low threshold, use. So these are just some of the challenges. And just to give you an example of kind of the things that we've been working on really diligently since January of 2022 when we first, talked about this work.
It does feel like we have the resources for the short-term strategies in terms of services, destigmatization, outreach, or connecting folks to case management and services. But not just moving or transitioning folks, expanding low-threshold housing stock, but then also, as you said, people getting interested in actually adjusting to this idea that this is the pathway to recovery. I guess I wonder if you can identify if there are gaps in terms, when you look at your short-term strategies, what are some of the things or best practices that we have not implemented, considering other places, and if there are any,
Right.
would you recommend?
So I will weigh in, but I'm sure others also, have thoughts about this. I speak as a doctor here, and I know the evidence base behind overdose prevention sites. And I don't think that I can be in this space and not say that this is a strategy that does work for some people. And it's a strategy which seems to have produced some success in New York City with On Point NYC, which we've visited. The state is supporting this effort. We're waiting for legislation in order to move something like this forward. And I do think that we need to tread cautiously, and figure out what works best and how many sites would work best. I think these are all things that we are evaluating. And just to emphasize, again, this is me speaking to the evidence base as a physician. And it's something that I know is part of what I think is important to the picture. But going back to Councilor Flynn's question, there are many different strategies that are important, and we can't just have one pathway that we think is missing and that we need to fix. There are many different approaches that we need to take, and one of them is making sure that continuum, once people are in detox, is smooth. How do people go from detox? And do you want to say a few words about that? Think CSS and talk about the continuum that isn't quite connected.
Yes, and so one of the things that we noticed after COVID, there was a lot of turnover in a lot of these facilities. So one of the things that PAFS has been working on is reestablishing new relationships with the CSS. So the CSS is a clinical stabilization unit. It's staffed by nursing, which is a big piece, right? We need nurses, and we also need a lot of other staff like case managers and clinicians to help also stabilize someone, introduce them to groups, maybe potentially even medications that can help them with their withdrawal symptoms. And so after the CSS is also working with them on a TSS, which is the transitional support program. Most people in a CSS, they can stay there anywhere from 14 days to 30 days, depending on their insurance. and then they can go to transitional supportive programming up to 90 days. And so really reestablishing those connections and connecting people to let them know that what they qualify for. I find that most often people just don't know that that is the next level of care. And then for someone who has stable housing or has access to family members or a place to stay and live, also connecting them perhaps to outpatient counseling. So one of the things that we have found is when individuals have access to a stable place to live, and they maybe have other supports like a primary care doctor and maybe access to a clinician that they can meet with, they are also very successful in outpatient counseling. So we have a satellite location. We partner up with the South Boston Collaborative Center. Yes.
Sorry. I'm sorry, we're just going too much into detail, and it may be good for folks to hear, but we're limited on time.
Okay,
I have to
sorry
ask
about
my next
that.
question. No problem, I appreciate the details. Considering, and this is for anyone, considering that you can't necessarily predict one formula in particularly to work for this person or that person based on culture, demographics, background, modality, whatever. When you think of the different modalities and you've put together this, amazing outlook plan, and you understand that there are different levels to this or phases to this, and again, not using one particular formula for every individual, have you or do you have someone that is doing quality control of some sort to assess your effectiveness in terms of continuum of service, but also just sort of wraparound? Is this truly happening in a wraparound model?
So I'll weigh in there and just say that we certainly have monitoring, evaluation, and quality improvement that has to occur within all of our programs at the Boston Public Health Commission, and certainly within the Work and Recovery Services Bureau, we do have that. I think what has been a challenge is the longer-term follow-up of people, because this is a statewide system, and people are going in different locations. So it's tough to know how successful person X was in getting through the entire trajectory. And so I think that's a challenge that everybody faces, but we're working on some of that and making sure that we have connections with all of our partners, or as many partners as possible, so that we do know how well people do at the end of the day. So I think that's a big piece of what we want to continue to work on, but we have made some strides on.
I guess going back to my question about gaps in terms of the short-term strategies, are there strategies that you would implement that you are not implementing currently?
So I mentioned one, that I talked about with overdose prevention. I think that some of what we're doing, we've talked about this as a team, really understanding who's out there. And so we've thought about doing another individualized survey, so really talking to people one-on-one. This is something that we've done in the past before, but we haven't necessarily done it recently. I think that's key, because what it does is what we just talked about. It gets us to understand exactly who that person is, what have their trials and tribulations been, and what has gotten them there, and then what will move them forward. The beauty of being here in Boston is that our problem isn't thousandfold. You know what I mean? It's not thousands of people. We're talking about hundreds of people who need help. Therefore, we have thought this through and said, okay, we can actually do this on an individualized level and understand people's struggles. And so when you ask what we haven't done, I wouldn't say that we've done some of that. You've seen some of that data in the past. We need to amplify that, particularly now that the encampments no longer exist and as people have, sort of spread in other places, around the city.
Are they hundreds, but then the numbers change because new people are coming in?
Well, certainly. We certainly have people who come into Boston. I think that that's been one of our challenges, is that we have services that other adjacent cities do not have. So certainly we do have people, but there are also Boston residents who are out there. And I do think we need to get a better understanding of who is who. And that's one of the things that we're actually devising or developing a survey right now that we're planning on implementing soon, so that we can get a better sense of what the needs are of this particular population who are out on the street.
Are there policy efforts that you're working on currently or planning on working on to expand the beds? You mentioned that after 30-day, treatment,
Right.
then where do they go? And if they're unhoused and then they're at risk and perpetuating the cycle.
So we are thinking about that. Some of that is under the state umbrella because they're paying for it, but we've talked about whether or not or how we can get people from detox to maybe, to CSS, and then is there some way that we could offer spaces for people who are done with detox in recovery and a space that separates them from folks who are actively using also, because I think that also can cause a challenge. So we've been thinking all of this through. I think, again, the challenge is staffing, the challenge is funding, and the challenge is actually space for us as a city to tackle this beyond what what the state is doing.
Thank you. I'll hold my questions for a second round. Thank you so much.
Thank you, Councilor Fernandez-Anderson. I'll now turn over the floor over to my colleagues, to the rest of the council in order of arrival. Councilor Julia Mejia, you have 7 minutes. Thank you.
You gonna put the clock on? You got your own clock? So I can see visually how much time I got left. Thank you. Thank you to the sponsors for hosting and to the administration, and also more importantly to the people who are here today to testify. And I just want to acknowledge that we have Domingos de la Rosa, who has been on the front lines here advocating even well before this became news, and has been sounding the alarm in our community in regards to what is happening. So I just want to thank you, Domingos, for your work in this space and for how you consistently show up. In fact, one of my Facebook memories popped up from 2020 when you organized a rally by, I forget where it was, in the South End somewhere, and I brought my daughter with me. And I think what is really important to note is that the level of frustration regarding this issue just continues to percolate. And there's the tension between, what community wants, what the advocates are asking for, what the administration is doing. It just feels like we have been trying to tackle this from so many different directions, and it feels like we move forward and then we go back. And I think there is, I always try to remain optimistic about what we can do, but at some point, we're gonna have to really think about more resources, right, to equip you all with the tools you need. We also need to talk about what enforcement looks like with compassion, right? I think that there's a tension here, a lot of frustration that we hear from business owners that people are turning a blind eye to the open drug market that you see. So there's that narrative there. And I guess that for me, as I continue to have these conversations with folks, it just feels like we're calling this the crisis, at Mass and Cass, but really this is a crisis all across the city of Boston. And I think it's not just isolated in one place. Because people are suffering in silence, and we are losing loved ones to overdoses that are not being reported. And so I think that when we're looking at the entire conversation, we're going to have to look beyond Mass and Cass. And I'm just curious to that point, what are you hearing and seeing as we're moving to the Back Bay, where we're moving to Nubian Square, when we're moving towards Eggleston Square? Can you just talk to me a little bit about what the administration is doing as this continues to spill throughout the city?
Mm-hmm. So, Councilor Mejia, I don't know if you would like to, or you guys would like to weigh in, because I've done a lot of the working.
So I think everyone kind of noticed about a month ago we started a kind of a new phase, new deployment down in the Mass and Cass area. It became very clear amongst the team that congregate drug use was becoming a barrier to a lot of things down there. It was a barrier to our outreach folks, recovery services. We just needed to really create a safer environment down there. So we started to focus directly on the congregate drug use. One of our concerns immediately was, is this going to displace people into the surrounding areas? So we immediately redeployed our officers into areas. We prioritized the area Immediately adjacent to there, the whole corridor leading up from Cass to West Cottage, the Nubian Square area, reallocated officers into those areas to increase visibility and to focus on quality of life issues. In that area, going back to a year ago, when the encampment was in place, to now, and even more specifically in the last 30 days, obviously the work is ongoing, but we see clear progress from where we were a year ago. Now we are communicating and coordinating with the new director of the CRT to have a broader deployment citywide, focused on areas where we're hearing feedback from the community. Number one, where people don't feel safe. We're increasing visibility, increasing our deployments and patrols, focusing on quality of life, but coordinating these efforts with the outreach folks and street outreach, recovery services, our housing partners, to make sure that in the areas that we're doing our increased enforcement and visibility aren't creating obstacles to outreach. So we've increased our communication, we're coordinating our deployments, we're focusing on these areas that we are hearing people their concerns.
Yeah.
And that's where we're focusing.
Yeah, so I also want to uplift to that. So my daughter plays at Clifford Park, and recently there's also been that spillover to the South Bay, and at Target in particular, now they have a sign that you have to, in order for you to come into Target, you have to come in with an adult. And I'm just curious, kind of from a safety perspective, what are we doing around helping to support our young people who are also being exposed to this visually and also just like mentally? What does that look like in terms of the support services that are coming out of the Boston Public Health Commission?
Mm-hmm. So I'll speak just to an example. In Nubian Square, where we have noted an uptick in individuals who are unsheltered, who are on the street, who are openly using, we have funded recently Bridge Over Troubled Waters, as well as a number of other community organizations. We've noted that there are younger and younger people who are out there, and young people, parents, caregivers, and their children are walking and sort of seeing this. And one of the things that they are focused in on is really thinking about what should we be doing differently for young people and supporting them in this type of situation. But I do think that what BPD was saying is important, that it is about, compassionately figure out ways to move people. They shouldn't, be congregating and what's happening and what people are saying not appropriate. Mm-hmm. So doing that, but then also realizing that supports need to be available for younger people as well as older people.
Yeah,
so,
and I think Councilor Santana put it at 6 minutes, not 7. Well, can't believe I have all that time already wasted. But
it did say 6.
It did say 6, right? I knew I had an extra minute because I know how to manage my time here, so I got an extra minute. But I wanted to just quickly say, I got an extra minute, that as we continue to have these conversations, I really, from the bottom of my heart, think that we can get to where we need to be without the divisiveness that I have seen in this dialogue. It is this sense of pitting people against each other in terms of what is the right way to deal with this, and nobody's winning if we continue to dig our heels in our camps. And I think that what this time is calling for us to do is to really find a middle ground in which we understand that not everyone's going to win. But at the end of the day, people want to see us as a council producing results. Because Leon Rivera on Twitter, it's constant that the city council is neglecting this. But the fact of the matter is that when I think about this work, you can't legislate human behavior. And we could do everything in our power to do X, Y, and Z, but what individuals are going to do, they're going to do, and we have to respect that. We also have to acknowledge our limitations. And I think that there is a false narrative that in this chamber, we're going to be able to solve this. And the only way we're really going to get at this is if everybody recognizes the role that they play in this conversation. and that accountability is not just here in the council or at the Boston Public Health Commission or within law enforcement or the business owners, is that everyone is going to have to do their part. And I know that there's task force and there's all of these things, but I just don't see that manifesting into deliverables. Like, how are we, I know you came here with data, but like, what has the community action plan, what are those results? You know, people have a lot of great ideas. How have you incorporated community voice, the business voice, the residents? How have you grappled with the difference of opinions in developing a plan that everyone feels seen? And I'm glad to see Minister Randy here, because his organization has been doing deep work in Nubian Square, and it has been such a great model. So when I talk about everyone being accountable, they have brought in that holistic strategy where you're bringing everyone to the table. And I'm wondering if he's a part of your table.
He is.
Okay.
He knows he is. So we all, so Boston Public Health Commission co-leads and co-established the Nubian Square Task Force that Torchlight is a major partner in, as well as a number of different community-based organizations. I think that there's been, in the last year, a scale-up of activities to really coordinate what it is they're doing so that they know, okay, here's naloxone, so we need to teach people about naloxone. We need to bring people to recovery. What does that look like? What are our outcomes on a monthly basis in terms of who goes to recovery? And let's bring new partners to the table. Let's partner with the healthcare providers while we're doing all this work. So I think that that's a model that's working, but it needs more resources. I think we need to put more effort and energy into that. And certainly it's not just about Nubian, it's about other places around the city. So I appreciate that, and thank you for being here.
Okay, thank you, Councilor Mejia. I also want to just mention that we've been joined by City Councilor at Large, Erin Murphy. Thank you for being here. You'll have the floor right now. Thank you.
Thank you. And thank you to the panel. So I was late. I was at the School on the Move Award this morning, and shout out, congratulations to the Matahunt for winning, and all of the schools doing great work. So sorry I'm a little late. But such an important conversation. I know we've been having it way before I got here, but from the 3 years I've been here, I've always thought of this crisis as like three different, stakeholders. There's those struggling that we saw on Atkins Street. We see now still in that area. We see that, in groups across the city now, and that to me has always been a very separate, specific kind of conversation. And thank you to Peter Barbuto, the Gavin Foundation. I know there's many nonprofits here who work directly in the recovery mental health space that work closely with you on the public health, knowing that, that struggle down there isn't solely ever going to be solved through the police. So that's one, right? And then there's the businesses who, not just down in Mass and Cass area, Andrew Square and others have been concerned for a long time, and then the residents. So knowing that this more is about, to me, like the public safety, getting a lot of calls and concerns from residents about their quality of life. And many people in the South End, Clifford Park, they've been dealing and struggling with this for a long time. They still feel, that they're struggling, but many new neighbors are, I think, for the first time seeing what it's really like in Andrew Square. It's been, something that's been tough for them for a while. And a lot of what we hear, so one of my questions is, that it's political. I got a call on Sunday morning from a resident who was upset. It was 8 a.m., so no traffic, no pedestrians, but had rolled through the stop sign at the Rotary near St. Monica's, near Andrew Square there, and was pulled over and got a ticket. And while they were writing out the ticket, there was 5 people, open drug use and using and selling drugs. So he was having, I guess, a conversation like, why am I, getting a ticket for rolling through? Like, But we're having this, like that, this is the issue, this is the public safety, this is the quality of life concerns that residents really have. And the answer, and what we've been hearing for a long time is, well, we're told to ignore it, or we're told if we do arrest people, then they get to court, and then the DA, the judges just send them back out. So wondering what is our focus still there, and what is our relationship with the DA's office and the courts to try to find better answers for residents who, honestly, I don't have a good answer when people ask me those questions. I mean, that was one example, but I know we all get calls like that, trying to balance, and not saying that anyone should ever roll through any stop sign, but when you think about where are we focusing our efforts, because oftentimes, and I had these conversations with John McGann a lot about like drug court and the supports you would get when you went in front of a judge, that it was, Judge Coffey and others, that it did give you the opportunity to then be set up with supports. And now if we're just skipping that altogether and kind of ignoring it, I think we're getting into like, just a more dangerous situation. So if anyone has thoughts, or
I'll just speak briefly. So I'm the new director. We came in late, so hi, I'm Kelly.
Thank you. Yeah.
So I am reshaping CRT to a more of a focused deterrence model. Having clear communication with BPD, which I do on a regular basis, usually multiple times a day, and using a multi-prong approach. We're able to offer different modalities partnering with BPD, that will increase the likelihood that someone will participate in their own pathway of recovery. So we're having a look at that, and we will be doing deflection and diversion training as we increase our outreach. Hoping to work more with Judge Coffey. She has created a wonderful pilot program that simplifies the process for court-mandated treatment. So we are having a look at that and at CRT.
Thank you.
So what we're working on now is basically you have different measures of crime. You have stats and how do people feel, right?
Yep.
So what we're trying to do
Both
is make
matter.
those match. In the areas that we have worked together on and coordinated our response, we're seeing differences. We see it in the stats, and we are getting feedback from some community members that are very positive about some of our recent deployments. We need to spread that out more. So those places that we see the difference is everywhere. So we're going to focus on, we're not telling our officers not to arrest people for open drug use and stuff like that. That's just not happening. So there's a lot to unpack with that interaction, and we can talk later if you want to get a little bit more into that. I'd be more than happy to speak with that person. But we want to spread out what we're doing in certain areas so we can see that forward progress everywhere.
We just yesterday had a working session, but we've been talking a lot on the council about police staffing, overtime, not having enough police officers, and a big percentage of the overtime is, spent on, the street outreach team, the mass and CAS. And as we're talking today about how it's not just not that it ever was just isolated, but we do see pockets across, like funding-wise, like how will we, and staffing-wise, how are we able to expand the good work you are doing in those pockets to make sure that, because we talk all the time that when we're already pulling special units to do, their 20 tours at different states, like, are we in a situation where we can support that expansion?
Sure. So in about the last 30 days, people can clearly see a change down in Mass and Cass. We did not add any additional resources to get that done. All we did was change the way we coordinate and supervise it. That's the only thing we did. We added a layer of coordination and supervising. Because, and I know we've all talked about this before, that's the intersection of 3 districts on 3 different areas operating on 3 different channels. So sometimes it's a coordination. So we do not increased deployments to the area to do that. So in some cases, we're focusing on putting more folks over at Nubian Square. A lot of that is on-duty personnel. It's not supplemental patrols.
It's not the street outreach, it's patrolmen on that day.
It's uniformed police officers from the district. And like I said, we're adding a layer of coordination. We're constantly monitoring conditions on the ground and making adjustments. So in that area, there's been no additional resources or expenditures made.
Okay, thank you, Chair.
Thank you, Councilor Murphy. At this time, I'd like to acknowledge that we've been joined by Council President Rusi Liu-Jen. You have the floor in 7 minutes. Thank you so much.
Thank you. Thank you, Mr. Chair, and I want to thank you, the panelists, for being here and for all of the various ways in which you all are dealing with, first and foremost, public health and public safety issues in that area. I guess a question that I had, and indulge me, I apologize if this question was asked and answered, and if so, you can say that. But with respect to what we've learned in the Massachusetts area, both from a public safety standpoint and from a public health standpoint, like how has that informed your work in the work on those suffering with the disease of addiction across the city and other areas outside of Massachusetts?
Maybe I can start with just the public health piece, and of course, we could talk about public safety. I think we've learned a lot in the last 3 years, and one of the strategies that I was speaking to with Councilor Fernandez-Anderson and the rest of the city councilors was this idea of really thinking about who people are, what their challenges are, and understanding that individualized case management is actually something we can do and do successfully here in Boston, given the size of our problem, of our challenges. We've been very successful in getting people from the Mass and Cass area, as we brought down the encampments and moved people into low-threshold shelter spaces, which has been a successful approach, though it's been very challenging because it's expensive, and maintaining that has been difficult for us and will continue to be a challenge. I think we've been successful in our outreach strategies, so not just being in one place, obviously, and not just having static places where people go, but getting out there and again, meeting people where they are and understanding what their challenges are, providing them with services, giving them options and trajectories that they can go on, and continuing to do it, because it's not going to be that one time. It's not going to be the second time. It may be the fourth, fifth, sixth time. I think the other strategy that I want to mention in terms of this coordinated response, I think that things have changed significantly in terms of our ability to talk across our institutions and to coordinate across institutions. Having been around a little bit before some of this started, I do think that there's been a much deeper partnership that's been created, and I think those are things that we learned in working in the Mass and Cass area with the encampments and then moving people from the encampments. Does anybody else want to respond?
Sure. I think we are going to see what has been working. There are areas where we see clear progress. Again, we look back to where we were a year ago with a permanent encampment. We all know what was going on down there. That no one would say that was a good thing for anyone, right? It had to be addressed. I think the coordination that we took place a year after the encampment ordinance was put in place, we have not made one single arrest under the encampment ordinance. During the 4 days of decampment, a police officer didn't even place a finger on a tent, right? That was just the beginning. And now where we are now, like with the Mass and Cass was really prioritized. We're starting to see the displacement. We want to use that coordination and control in these other pockets. The CRT is reorganizing to spread out citywide. Focus on putting visibility in locations where we're getting feedback from residents, whether it's actual measurable stats or the feeling of unsafety, right? Because we can talk about stats all day. In the Mass and Cass area, overall violent crime is down 27%. Like robberies are down 25%. The list goes on. But if people don't feel safe there, it doesn't mean anything, right? So that's our objective now, is to continue the coordination. We see clear progress in the Mass and Cass area. The other places that we've adjusted our deployments, we're starting to get positive feedback. We're not doing a victory lap by any stretch of the imagination. The work is ongoing. We have a lot of work to do. But we do see where we work together and work with the community and listen to what they're saying and make deployments based on that total package, and nobody does it by themselves. We see evidence of clear progress, and we're going to continue to build on that.
Thank you. I have a question back to you, Dr. Ochukutu. You stated that it was something that we've learned and that we've gotten better at is individualized case management, right? That's a strategy, and I agree. But if there are folks who are looking at the Massachusetts area, they're like, well, if there's individualized case management, if that's a success model, why are we still seeing people in the area who don't look like they're receiving the services that would, prevent the quality of life issues that folks are experiencing? So how would you respond to that?
Okay. So substance use disorder is a chronic illness, very difficult to address, and not everybody wants the services that we are necessarily offering. Not everybody wants to go to detox. Not everybody wants to go to a day space. This is a challenge, and I think it's a challenge not just here in Boston. This is a challenge, nationwide. How do you deal with a chronic illness where you have people who are addicted to a substance and they know where they can go and get the substance, and that isn't, they aren't ready yet to say no and do something else. So in as much individualized case management that you can put in there, we capture a lot of people that way, but there are going to be people who are just not ready for services yet. And so that's my response.
Are you seeing new people, new individuals with this illness coming to the area, or is it more so, are you seeing a steady stream of new people, or is it the habitual folks who have been down there?
I think it's a mix, and I don't know if anybody else wants to comment because you all are obviously also have boots on the ground. I think that there are people who certainly are newer to the area, but then there's certainly people who've been there a long time and who are transiently engaged in services, but they're not necessarily, as I said, ready to completely leave the area or completely move on to, the services they may be provided for long-term recovery.
Thank you, and I'm assuming, Superintendent, it's the same for you.
Sure. I mean, there's a number of anecdotes that I get from my folks down there. After our shift in deployments about 30 days ago, that second weekend it rained, and I sent the troops out there, said, find everybody. Where is everybody? We found one pocket of 8 people under the bridge at Mass Ave. That's it. Everyone else was off the street in some sort of shelter or housing setting. There was no one out there.
Thank you. Well, my time is going to run out, but I would just want to uplift the work of the BEST team. I'm sure that there are folks my colleagues who have already addressed the BEST team and the work that they do. Want to just further announce my support for that co-response model. I think it's a great one, and also want to shout out the incredible work that Sue Sullivan and her team are doing really to get people a sense of dignity through work. And it's a model that I want to see us work on throughout the city, and I know that Councilor Fernandez Anderson in Nubian Square is looking into that. I think it's just we need more models where we're helping people get regrounded and rooted in dignity. So I want to thank the panelists. I want to thank everyone who's doing that work.
Thank you, Council President. Well, now I do have a couple follow-up questions from around. I won't take up the 7 minutes, but I'll still time myself, and then we'll do a quick second round of questions. And then move on to next. So very quickly, Director Young, I do want to focus on the coordinated response. Congratulations on the new role. And as I mentioned before, I had the opportunity to go tour, be on the ground with your team just a few weeks ago. You talked about you're bringing some changes. You want to expand your team. You may want to change the approach. Can you speak to what changes are going to be made, and then what can residents and us expect from this change?
Well, sure. So I am shifting CRT to respond citywide. And as I spoke earlier, there are many different modalities for outreach. So we are going to switch to more of a co-response model. And we will respond with police when appropriate. Because we are finding that a lot of the population are unmotivated and disengaged. We're such a resource-rich city. So looking at that and seeing how we can motivate people to be active in their own recovery.
Attention please. The signal tone you have just heard indicates a report of an emergency in this building. If your floor evacuation signal sounds after this message, walk to the nearest stairway and leave the floor. While the report is being
We are back in session. Sorry about that. We had to evacuate the building due to a fire alarm, but we are back in session. Appreciate everyone's patience. So we're going to move. We're going to move forward with our. We have a list of invited public testimony, and want to thank our first panelists earlier today that were here to answer our questions. A variety of residents and organizations experience impacts related to the matter at hand. We have a second community panel coming up, but there are more community members to hear from than we can host on our panels today. To hear more voices, the committee has invited a handful of people to provide some extended public testimony, which I would like to invite at this time, and then we'll move forward with our second panel. So for the invited speakers, when your name is called, please state your name, neighborhood, and organization affiliation. And please keep your comments to 5 minutes. I'll have the clock right behind me with 5 minutes. So first up, we have Linda Zablocki from the Andrew Square Civic Association. And then as Linda's coming down, we're going to call Peter Barputo, the president and CEO of Gavin House. And then we will have Karen LaFrasia on Zoom from the same Francis House. So.
Do I go here?
Yep, that's fine, yep.
First time.
No. Thank you so much for, thank you, Linda, for being here with us. You'll have 5 minutes. You can go ahead.
Good morning, everybody. My name is Linda Zablocki. I'm a lifelong resident of Andrew Square and the president of Andrew Square Association. I'm here to talk about the continued and growing problems in Andrew Square.
Can we move forward to the microphone so we can hear you? Make sure
Oh,
we
I'm
can hear
sorry.
You.
Is that better?
That is fine.
Sorry.
Thank you.
Do I get my roll back?
Yeah, how about that? Let's start that.
Good morning, everybody. My name is Linda Zablocki. I'm a lifelong resident of Andrew Square and the president of Andrew Square Civic Association. I'm here to talk about the continued and growing problems in Andrew Square from the homeless and addicts. Not too long ago, the CRT, who we absolutely ultimately respect, gave out some statistics stating that activity down at Mass and Cass was down by 60%. And that is a focus on Mass and Cass, as Councilor Mejia said. And that is an amazing number. But the problem being is that the 60% now is infiltrated deeper into the neighborhoods. We have people on our stairs using drugs, trying to get into our halls, in the backyards, breaking into garages, taking more packages, leaving more litter and food all around our homes. So that 60% is now off Mass Cass, has made a quality of life in and around Andrew Square, and I'm sure the South End and the adjoining neighborhoods even lower than what it has been. It is much more dangerous walking in our neighborhood. We're just moving a problem, we are not solving it. Just like the placement of people into the roundhouse, all we did was put the illegal use of drugs off the streets behind closed doors. Nothing else changed. I understand that safe injection sites are being considered to try to curb drug addiction. We support the efforts to curb the opioid crisis, ravaging this area in the entire country and state. But injection sites are not the answer. Canada, California, Australia are closing down injection sites because they are not working. With these sites, we are condoning and enabling this addiction to continue, let alone we're allowing an illegal activity to take place in a building that is paid for by taxpayers who are abiding by the law. If you look at the numbers in the report by David Stone, and I implore that you do, you will see that the return of this type of program is minimal. Long-term rehab is what is needed. We can't treat an addiction for 30 days and release the person and expect everything to be okay or for them to continue without constant support. We are up against a very powerful monster. It will take even more powerful programs to eliminate this monster. The plans for Long Island are still 6-7 years away, and in the meantime, we may lose many people out in these streets. Every single person out there is somebody. We need a program now because as I stand here and talk, lives are being lost, and shame on us for allowing it. The saying is you need to hit rock bottom before you go into a program, but why can't we precipitate rock bottom? We should be arresting illegal drug use and prostitution and putting these people in long-term lockup programs and give them a fighting chance. Right now, we continue to help them in a downward spiral, continued addiction, and eventually death. I'll tell you, my friend Linda, who buried her daughter, soon after buried her daughter's boyfriend, who was the father of her 2 granddaughters, and 20 years later, buried both those granddaughters due to addiction. My cousin Rhonda, who was released from jail on a Monday, went up to the clinic on Tuesday, got a prescription for Klonopin and Neurontin, sold her prescriptions, and was dead in the hallway in Mary Ellen McCormick Housing Development on Friday. This young lady had a 3-year-old son, but that didn't matter because the drug owns them. I can guarantee you that there has been long-term programs for many of these loved ones. The parents would have absolutely had them involved. You can't have a revolving door when you're dealing with the addiction. The drug is so powerful, people give up their children, women give up themselves, men become thieves. It's a vicious, vicious cycle, and we are condoning it. This is what we're allowing to continue, and it really needs to change. What we're doing is not working. We will never know what will work if we don't try. But from the statistics, the injection site places are failing miserably. There are programs like Stony Brook Stabilization in Springfield, which has a very high recovery rate. Why are we not instituting programs that work? I'm sorry, I have to go to my next page. We acknowledge that there is a crisis that has plagued us for generations. It's particularly strong in Andrews Square area because of the overflow. We don't blame this administration, but it is the administration's problem now. And we ask that we passionately strive with you to find a solution that works. We are your partners. We are requesting a pivot towards something new and different. We need recovery campuses in Boston and across the state. Recovery campuses with long-term residential addiction and mental health programming with wraparound services to prepare folks for the future, out of addiction. And lastly, I'm going to say, we as a civilized society have an obligation to make choices for those who physically and mentally are not capable of doing so, and we are failing miserably. Thank you.
Thank you, Linda. Next up, we have Peter. Thank you so much for being here. You have 5 minutes.
Sure. Thank you to the Boston City Council. My name is Peter Barbuto, and I am the president and CEO at Gavin Foundation. I'm quite sure you all know my predecessor, John McGann, who was here at Gavin for 31 years when he retired this summer. John was recognized right here by the City Council in July for his relentless dedication to our mission. I feel incredibly fortunate to be chosen to be a successor at Gavin. He's been a friend for a long time and someone I consider a mentor. The folks at Gavin are the people that they showed me a better way of life. When I was struggling with substance use, my person in long-term recovery from opiate use disorder, I was a resident at Gavin Foundation in 2006. Gavin has been providing services for individuals with substance use disorder for over 60 years in the city of Boston. We operate an inpatient facility, Gavin Quincy, that provides detox and stabilization services. We have 4 recovery residential programs, all 4 in Boston, and they have about 110 residents in them today. We have a peer recovery center in South Boston, less than half a mile from Mass and Cass, open 7 days a week, staffed with over 20 recovery coaches and recovery navigators who provide care coordination to its participants. And we have an outpatient site as well as many other mobile case management services. In 2024, we'll provide services to over 10,000 people in the Commonwealth within our continuum. None of this makes us experts in any way. Substance use is an incredibly challenging disease to combat, as you've heard today already. And there is no linear path that anyone can take to ensure it's permanently eradicated. But as someone who has facilitated thousands of treatment episodes over the past 15 plus years, I have a lot of experience with this population and what precipitates someone wanting to receive help. Addiction, substance misuse causes irrational thinking and therefore irrational behavior. We don't have a drinking or a drugging problem. We have a thinking problem. addiction. None of the individuals who are struggling with substances and lingering around these neighborhoods like Masson Cass and Andrew Square are there because they want to be. They're there because they have to be. They've lost all power to choose. Drugs and alcohol continue to make all of their choices for them. Very seldom do we hear of people waking up one day and just deciding, today's the day I'm going to change. There's some life-changing intervention that is the catalyst. The treatment process starts by a separation from substances, which you heard today with detox, however painful that may be, followed by a very long and arduous treatment process of retraining these individuals how to think. The efforts of the City of Boston and all of the supporting agencies thus far really have been commendable. This is really hard work. And a lot of incredibly passionate people have done amazing work at Masson Cass, and some of them were on our first panel. At Gavin, we continue to do whatever we can to support these efforts and look forward to any solutions in the future that come from meetings like this. In the past, folks from the Health Commission, Department of Public Health have called to alert us of any sweeps that may be occurring. So we keep some of our beds open at our inpatient site in Quincy to streamline individuals that are willing to accept any kind of treatment, right? Not all those beds were used. In our experience, we see but 4 types of people that we're discussing today. First type, they're people that use drugs. I've spent the past 12 years of my professional life working in the behavioral health field on a national scale. Massachusetts has one of, if not the very best treatment system in the country. There is access. I realize that my thoughts on this may be controversial, but I'm a believer in Section 35. I've seen it used thousands of times, and it's a very successful intervention. I was a drug user during the beginning stages of the opioid epidemic. Treatment was offered, and you were either going willingly or unwillingly. Back to my point about the thought of the treatment process and those who, as someone who used drugs, it's warped. The thinking process is not okay. I just don't believe that the folks in Masson Cass are thinking right. So we need to make decisions for them as providers. They live in tents and linger in dangerous places, again, because they have no choice. These folks think it's in their best interest to be there, but we all know it's not. If some of these people are involved in the criminal justice system, then that process should play out. Agencies like Gavin and others partner with the courts to be of assistance where appropriate. Councillor Flynn knows that in his previous life. But this is not the worst option. Incarceration can be a successful interruption of lethal consequences that drug use presents. Finding out the benefits of recovery while incarcerated is not uncommon. In summary, this group needs treatment, and that treatment plan needs to be long and arduous, and the Commonwealth has those options right here. And those options provide wraparound services, long-term case management to address the needs of this population. We've seen many folks that have experience at Masson Cass be successful in the continuum we have at Gavin. And we've managed their medication, and we've introduced them to community support mechanisms, and we've worked with them to find jobs. And over time, we've assisted them with housing. None of this is an overnight process. The second type of people down there are the people that sell drugs, and they need to be prosecuted. And if we are successful in assisting the customer base, we would successfully eliminate these people indirectly. The third type of person down there are people that are human trafficking, and they make very special places for those people. The fourth type of person are people with serious mental illness, and we need a similar system that we have with the people who use drugs, with the help of countless programs available to the DMH system and the many service providers who conduct this work. In closing, I'm a sports guy, always have been. I love Coach Belichick and other incredible leaders that we see. One of the quotes that I bring to team meetings all the time that I feel is appropriate here is, when we have issues, we're either coaching it or we're allowing it to happen. The response to Masson Cass has been commendable, But my suggestion is that we put our foot down and stop allowing this behavior to continue, because I don't believe we are coaching it and teaching it. I love this population. We've dedicated our life's work to providing services to them. But they, like everyone else, need consequences, and those consequences generally drive behavior change. It requires the continued collaboration of service providers, government agencies, law enforcement, trial courts, as well as the community. Gavin would like nothing more to be a part of that collaboration with the many dedicated people on the front lines. Thank you.
Thank you, Peter. Next up, we're going to have Karen LaFrasia, who's going to be on Zoom, followed by Ed Cameron, who's in person, and then we'll move on from there. So, Karen, you have the floor, and you have 5 minutes. Thank you so much for being here.
Thank you. Well, good afternoon. My name is Karen LaFrasia, and I'm the president and CEO of St. Francis House. We are the City of Boston's largest provider of day shelter and wraparound services to adults experiencing homelessness. I want to thank Councilors Flynn, Fernandez Anderson, and Santana for holding this important hearing. It's been a year since the encampment at Mass and Cass was removed, and the city is certainly to be commended on the approach taken to dismantling of the tents, ensuring that every person had access to a shelter bed and a pathway to treatment and housing. While this effort was an important first step in meeting the health and safety needs of the men and women in the encampments and for those in the surrounding neighborhoods, more still needs to be done. Far too many people continue to languish in the area and across the city in need of access to a full continuum of clinical treatment for a substance use disorder, post-treatment recovery supports, and housing with on-site supportive services. We all know there is a public safety issue, and I believe treatment is the best public safety response. For 40 years, St. Francis House has engaged homeless adults, many with active addiction, to create a path to recovery, employment, and housing. Over the past 10 years since the closing of Long Island, the rise in opioid and fentanyl use deaths, and the lack of affordable housing, St. Francis House has increased its continuum of recovery-oriented services. In our experience, what works and what is needed is to scale a system that ensures seamless transitions through a continuum of care, starting with harm reduction services and low-threshold shelters, access to detox and clinical treatment, transitional care and stabilization, and ultimately permanent housing with wraparound services. This system of care needs the political will and the resources necessary to ensure there is enough capacity for someone to move unimpeded through the system. Within our sphere of influence at St. Francis House, we have created a small such ecosystem of care. In order to meet someone wherever they are in their recovery journey, we deployed 3 harm reduction specialists and 2 access clinicians to conduct outreach and engage with individuals with active substance use and untreated mental health disorders. In the last year, we served 502 individuals, reducing the harm they caused to themselves and to others. And most recently, we obtained a license from the state to provide on-site day treatment and individual substance use disorder therapy for homeless individuals. In the first year of providing this service, 243 unique individuals participated, and another 1,260 individuals frequented our peer-run recovery support center for help maintaining their recovery. What we have learned is that even someone who has been on the streets for years and feels hopeless can and will engage in services if those services are offered with minimum barriers and there is the real promise of ultimately obtaining a permanent place to live. In January of 22, as part of the city's effort to establish low-threshold shelters for those living in the Mass and Cass encampment, St. Francis House established the Willows at Woods Mullen Shelter, a harm reduction shelter for 24 women. And we've operated this program until September of 22, when Victory Programs took it over. During those initial 9 months, St. Francis House served 58 women who had been homeless for an average of 4.4 years. By providing safety, stability, and services, 50% engaged in substance use disorder treatment, 53% were receiving treatment for a mental health issue, and 50% were getting medical care to meet their physical health needs. And because of the stability the shelter offered, 67% were connected to a housing resource. By creating meaningful connections and reducing barriers to accessing services, for those that are congregating at Mass and Cass and throughout the city, many will take advantage of the services when barriers like transportation are removed. For example, from July of 22 to June of 24, the city provided a van to transport people out of the area into day service programs like St. Francis House. In the last year of this service, 633 people took advantage of the recovery route, as it was known, and they came to St. Francis House. And while nearly all took advantage of getting a meal, taking a shower, and getting clean clothes, 25% used our recovery support center, and an additional 20% engaged in case management, employment, and housing services. Unfortunately, this service was discontinued this past June. And no continuum is complete without the real promise of permanent housing with on-site wraparound services. St. Francis House currently operates 2 locations in downtown with 102 units and another 226 units of affordable housing in development, 118 to be set aside for those coming out of homelessness. However, much more needs to be done to support the siting of new permanent housing developments within the city and in the surrounding communities. And finally, surrounding cities and towns need to establish their own robust continuums targeting people with substance use disorder and experiencing homelessness. Any scaled response must take a regional approach. Other cities and towns need to join the City of Boston and follow our lead of creating compassionate, coordinated care. Summary: challenges to scaling this: competitive wages for our workforce, transportation services to get people to the services that they need, siting, low-threshold shelter and permanent supported housing, and WOM handoffs. They're good, but they don't always work. We need a continuity of case management, of care coordinators to follow people from shelter to housing. We should introduce contingency management therapy to provide people for positive behavioral change. We need more investments in work opportunities like the state's access to recovery program. And yes, we need to expand drug courts. And finally, yes, arrest the drug dealer, but not the addict. Thank you.
Thank you so much, Karen. Next up, we have Ed Cameron, and then we're going to go back, follow up with Jonathan Alves and David Stone. So, Ed, thank you so much for being here, and you have 5 minutes.
Thank you, Chair Santana, and thank you, Councilor Flynn, and thank you for having us here to discuss this very important issue. Am I loud enough, or should I lean over? All right. So my name is Ed Cameron. I'm a senior director at the Pine Street Inn, and I oversee our street outreach program. And just as a bit of a program overview, and I know this is probably well known to members of the council, Pine Street since 1986 has had 2 outreach vans that have gone out on the streets of Boston each night. That is and has been funded by the state. Now it's EOHLC. And we have daytime programs, and we've had a lot of support from the City of Boston in terms of our daytime capacity, and we've expanded that to include our ability to cover all the parts of Boston in terms of coverage, and we work very closely with the CRT on that on a weekly and daily basis, as well as providing housing resources for people. Each year, we are able to house about 90 folks off of the streets into housing, supportive housing of one way, shape, or form. So we do see successes, and as many people have said earlier in their testimony, this is a long road to hoe. There's a lot of misery out there, very challenging circumstances with the drug scene of the last few years in terms of the power of the addiction. And we continue to be a part of what's going on down in the Mass-Cass area on a daily and nightly basis. We're not in the heart of Mass-Cass near Atkinson Street because that is served by several other providers, including BPHC. But we are in Andrews Square, Edward Everett Square, Nubian, Newmarket. And in terms of the numbers that we see on the streets of Boston, we are seeing similar numbers to past years, but it is very dynamic, and our staff call it sort of pop-up pop-up situations where people are more numerous in certain areas and less numerous in others. Just last night, we only saw 2 people at the Boston Public Library, which has typically been a busy spot for us over the last couple of years. So we only saw 2 people there, but we saw 29 people at Downtown Crossing, 23 at South Station, and 17 at Nubian. So, our ability at night to be out in all of those areas can help us identify who's in need, track people across different areas, and provide those services that they need. I see the gaps around just the need for continued coordination. Sometimes there can be just a singular focus for each agency or program or department. We have lots of ways that we connect on a weekly and tactical basis, and also strategically. Certainly, more housing resources and substance use resources, particularly post-detox, in working on the law enforcement angle and Section 35 and drug courts and treating addiction, and certainly criminalizing drug dealing is important. And also just want to emphasize the tactical. We at Pine Street are part of numerous meetings, Nubian, East Boston, Back Bay, and the Boston Public Library, and MassCast. There's a weekly meeting as well. But continuing just to kind of tighten those connections. Police are often involved there as well in a supportive way, and I think we are making some progress. As was asked earlier and discussed, there are new people coming in, into the streets from outside of Boston, but also Bostonians as well, and then people disappearing. So I think the focus with MassCast around the substance use treatment is really what is most needed, and we'll continue to play our part and appreciate the strong support of the City Council and the city as well. So thank you.
Thank you so much, Ed. We're going to go to Jonathan Alves, who's on Zoom, and then if we have David Stone, they'll go up next. So, Jonathan, you have 5 minutes.
Hi, can you hear me okay?
Yes, we can hear you. Thank you.
Okay, thank you. So I'm on the train to New York City right now for business, but hopefully I'm coming through and there's not too many audio issues. So I'd like to thank Councilor Flynn for calling this very important hearing. I'd like to thank Councilor Murphy for her support, Fitzgerald, Tanya Fernandez for her support. This is a super critical issue. My name is Jonathan Alves. I am a 10-year resident of the South End of Boston. I am a member of the Blackstone and Franklin Square Neighborhood Association, South End Business Alliance, and a recent father to an 8-month-old daughter. I'm testifying today to exclaim, and I've been intimately connected to this issue on a resident level for 10 years. I'm testifying today to exclaim that the conditions at Mass and Cass and beyond remain inhumane and out of control for everyone involved. That includes the people suffering, that includes the residents, that includes the businesses. I have personally picked up hundreds of needles over the last several years in South End parks. I am personally concerned that needles and unsafe conditions exist today in parks, in neighborhoods. Being a new father, I'm even more concerned. I also want to say that the little success that I have seen in terms of quality of life issues for residents has been directly correlated to the efforts of District 4 Police under the leadership of Captain Sweeney. Now, most of us know and agree that this is not a police issue. The police are not going to solve this issue for us. This is a political issue. This is an issue that requires elected officials. It requires the City of Boston to support and execute. I'm testifying today to explain that what we are doing, the policy of meeting people where they are, is not working. Now, we have examples and we have plans that have been organically developed at a community level to help address this problem. Things like Recover Boston, mandated treatment protocols that have successfully worked in other countries like Portugal, who is a similar size as the state of Massachusetts and had a major problem like this coming out of the dictatorship era. I challenge the city, I challenge our mayor, I challenge our city councilors, I challenge our state to start imploring more mandated treatment protocols. While doing so, continuing to support, aggressively support, resources on the ground with our police who are making a difference for quality of life issues. Thank you so much for the opportunity, and thank you for the time.
Thank you so much, Jonathan. Next up, we have David Stone from the Black. Oh, you can introduce yourself, but thank you so much, David, for being here. You have 5 minutes.
Great, thank you. Good afternoon, everyone. My name is David Stone. I'm a 28-year resident of the South End. I'm also president of the Blackstone Franklin Square Neighborhood Association, although the opinions here are strictly my own. I appreciate this chance you're offered us to relate residents' experience since the clearance of the Atkinson Street encampment in the drug scene exactly 12 months ago. I think that was a necessary action, and I think we mostly all agree on that, but it's one that you need to know has resulted in many people who use drugs dispersing deeper into the surrounding neighborhoods, including my own block of East Brookline Street, which is a 5-minute walk from Mass and Cass. Multiple times a day, I see people come onto my street specifically to use drugs, usually making a beeline for an underutilized parking garage that's become known as a pit stop, a place to take a break while shuffling around the neighborhood, which unfortunately is how many people appear to exist now that spending all day on Atkinson Street is no longer an option. More often than not, from what I can see, these stopovers involve using drugs. Consequently, the area across the street from my house is littered with drug paraphernalia, abandoned clothing, remnants of stolen packages, and sometimes human waste, and is becoming a public nuisance. Most mornings, walking my dogs, I pass evidence of more drug use that's happened overnight. Usually, it's orange needle caps that weren't there the evening before, or it's a pink plastic tube for sterile solution. But since last year, there are now increasingly also times when the evidence is a human being lying flat on his back or on his face on the Harrison Avenue sidewalk in some combination of sleep or over-sedation. It didn't used to be this way. As recently as 2 or 3 years ago, visible drug use was a rare sight on my street, and someone sleeping rough would have been shocking on the corner. Now, everyone just walks on by, including me, quite frankly, much of the time. But realistically, what can we do? Contacting 311 is ineffective, since people will be long gone when outreach shows up, and most likely, as we heard earlier today from some of the expert panelists, will likely decline help anyway. And we've made a societal decision not to treat public drug use or sleeping rough as situations that justify immediate intervention. Now, I have a privileged life, and it's important to say that whatever problems drug use causes me or my neighbors can't remotely be equated to what's been experienced by those addicted to them. But let's not pretend that tolerating large amounts of ongoing drug use and the property crime and disorder that inevitably and always goes along with large amounts of drug use isn't harming communities, because it is. As the City Council considers next steps on Mass and Cass, it's important to know that other cities facing these same challenges have begun to change their approach, and this is maybe my most important point I want to get across. There's a growing movement on the West Coast and in Canada away from the unquestioned primacy of the harm reduction philosophy and toward what might be called intervention first model. In May, for example, San Francisco Mayor London Breed endorsed and voters passed a ballot measure requiring that addicted homeless persons enter drug treatment whether they want to or not, or else forfeit their city-funded housing and cash benefits. In September, the Berkeley City Council joined a long list of other California communities that are enacting much stricter anti-encampment ordinances and policies, including to require that people enter shelter when it's available. And a few weeks ago, the Seattle City Council passed a quote-unquote stay out of drug areas ordinance. Under this law, a judge can ban people charged with property destruction, criminal trespass, or similar crimes like that from entering a specific part of the city if the judge thinks that that crime or that alleged crime was associated with the person's drug use. Up in Canada, similar things are happening. The government of Ontario just announced a ban on any new supervised drug consumption sites going forward and the closure of about half the existing sites due to the perceived crime problems and a public policy pivot away from harm reduction up there. In May, British Columbia joined Oregon in recriminalizing public use of fentanyl and other hard drugs after their decriminalization experiment led to an explosion of in-your-face public drug use and proved the impossibility legally and practically of preserving any limits on drug use under decriminalization. And last month, the Premier of British Columbia came out in favor of involuntary care for people with co-occurring addiction and mental illness, saying his province would add hundreds of mental health beds and secure wards. That's a pretty remarkable change, considering that nowhere in the world has gone farther in embracing harm reduction up to now than British Columbia, and the Premier in question used to be the head of the BC Civil Liberties Union. I mention these things not to endorse every concept, but to demonstrate to the Council that many of Boston's peer cities, cities that just like Boston have a long history of trying to do the right thing, cities that have brought vast resources to bear, cities that are politically progressive, just like we might wish to think of ourselves, have decided to try something different and focus on proactive intervention to more effectively end the interrelated crises of drug use and homelessness. I suggest we do the same here in Boston. Thank you.
Thank you, David. And really want to thank our invited public testimony. I'm now going to, before we go on to our second panel, I am going to take 4 individuals from who have signed up to testify. We're going to give you each 2 minutes. We're going to start with Catherine Kennedy. Thank you so much for your patience.
Can I have the extra copies? Do I need to, who do I give extra copies to? Or
I'm sorry?
I was supposed to bring 15 copies of what I'm supposed to say. So.
Oh, yes.
Oh, yeah.
Thank you.
So.
You can start. Yep.
Okay.
Thank you.
Hi, my name's Catherine Kennedy, and I'm a longtime resident of Beacon Hill, and I'm also a mother of 2. One of them is with me today. He's 6 months old. To whom it may concern, I'm thrilled that the city is taking the safety concerns of families seriously and has recently taken positive steps to make the Boston Common safer. But I fear that Boston and the surrounding region is not doing enough to actually disrupt the cycle of addiction that has led to this crisis. By not having a thoughtful plan, the city just keeps moving this problem instead of solving it. I've lived in Beacon Hill for a decade. Prior to this year, I've never seen the Boston Common, Cambridge Street, or the Esplanade get this overrun with drug paraphernalia or folks in crisis. I carry a Sharps container from the health department in my diaper bag. There have been multiple safety incidents recently in our neighborhood that involve children and caregivers with individuals who are a danger to themselves and others. As a mother of 2 small children, this is very scary. Average citizens, including children and the elderly, need their homes and public spaces to be safe. And folks with complex behavioral health issues like addiction need high support environments with guardrails. Letting these 2 populations mix is failing both groups. The city keeps talking about low-touch solutions for those facing addiction. For example, permanent supportive housing sites that have no requirement for sobriety, and placing them in residential neighborhoods next to families and schools. Solutions like this just invite drug dealers, sex work, theft, gang activity into new places. They do not separate dealers from users. And they force regular citizens, including families and the elderly, to be in the crossfire. In my opinion, these low-touch solutions are a mistake that puts everyone at risk. I beg you, choose solutions that keep vulnerable people away from potential danger. Safety should be the highest priority. Thank you.
Thank you so much, Catherine. Thank you so much for being here. Next up, we'll have John Stillwagon. No. All right, we're going to have Domingos De Rosa. Thank you so much for being here. You have 2 minutes. Thank you so much for being here. You have the floor.
Domingos De Rosa, lifelong resident of Boston. I'm the president of the Boston Bengals Pop Warner program. Was established in 1999. Also a member and co-founder of the South End Roxbury Community Partnership. This is a group of neighbors who came together to address this human health crisis. I believe at one point we were the first group to identify it as a human health crisis. I'm also part of the Friends of Clifford Park. This park is one of our true gems within that section of the city, where our families come to entertain themselves in different capacities. But we've been speaking on this for quite some time. We see the work that's happening from different departments, different organizations, and we give them their applause. Without them, this would actually be even bigger of an issue. So I want to say that. I'm not here to bash anybody, but I'm here to speak some truth to reality. Today, what I noticed was the inconsistency from the city's behalf. And what I mean by that is there was a panel here, they're gone. We, the community who come here to give our testimonies and bring some of our concerns to the city council, we're here to sit and wait through like today's experience, you know. That is very troubling because, again, the galley's empty. And we, the community, this baby behind me, like I said to the mom, I'm definitely echoing what she's saying because that's how I got involved over 10 years ago when kids that I mentor couldn't use the park safely. It was being pushed aside that it was a myth by city staff. That's on public record. Mass and Cash does not have the issues that we see today. It manifested from statements like that being made 10 years ago by the city. We have questions that we want to ask the city council. These department heads are great. They actually are employed by us. So I understand their resumes because they're online. And that's what we get when we hear a lot of this information. It's just regurgitated from community meeting to community meeting to community meeting to community meeting to another community meeting. And folks who are here, who have been involved, they will tell you it's the same input that's been being given by departments for years now. There's been plans put together by the community, like Jonathan said, that will actually help and bring back a life into a community that's dying. Like our families can't go food shopping. We had a stabbing last night. When the police tell us the area is safe, but then we had a stabbing last night. A guy get hit off a motorcycle blocks away. Mass and Cash is not just Mass and Cash. It's Pierce Square. It's Ashmont Station. It's Ruggles. It's Franklin Field. It's Franklin Park. It's the black community. I survived it. We have T-shirts called Surviving the 80s. We did use the police and the court systems to put people in places to help adjust lifestyles, right? Because I'm trying to be as respectful as I can because the frustration comes when 2 seasons in a row we no longer can fully operate as a program because Mass and Cash has overwhelmed the community. So we're here to ask, what is the city council going to do? We're here to talk about an ordinance that was put in play a year ago, which was bullshit. It fanned out. It was like, you know, throwing water mixed with oil on a fire and then expect the fire department to come out and put it off. A Tesla on the highway. Let's use that even better. So you can have a graphic vision of how y'all are killing us. If we can put an ordinance to ban tents and we got laws that prohibit people from opening use of drugs, The drug dealer has an addiction too, because I was one of them at one point. And I love the thrill of evading the police first and foremost, right? So we have re-engagement programs to help folks who have that addiction. So it's no one's winning. But if there's things that we can do is actually put things into play that we can actually make people. We make our children go to school. I have to tell my daughter school is good for her. At the same time, I tell her a needle the doctor gives her. And again, I hope this child here never gets pricked by a needle, because that is the reality of her sliding down he sliding down a slide in our parks. So I'll end by saying this. The city council has to take control of this. No more asking providers of what they're doing, because their grant writing skills are great. They get millions. We have a new Shattuck Hospital coming to North Newton Street we haven't talked about. We have other issues coming to the area, such as the Roxbury Prep High School, who's going to be dead smack in the middle of that. What are we doing to ensure safety of those children? So the list goes on. So I'll say we appreciate the hearing, but let's put it at a reasonable time where working people can attend. We had one in the South End at the McKinnick School. That was at 6 o'clock at night. People can attend. 10 o'clock in the morning is not for the community. So for future meetings, please keep that in consideration. Thank you.
Thank you, Domingos. Appreciate your testimony.
Good morning and thank you. My name is Marla Murphy-Smith. I'm a resident of Shirley Street, where my family has lived for close to 100 years, and a neighbor to Clifford Park. It's literally 50 steps from my house. I'm a member of the South End Roxbury Community Partnership and also the Friends of Clifford Park. I don't get a tour of Mass and Cass. I have to move through it every day. It's called my commute to work. I testified at the invitation of Erin Murphy just about 2 years ago on this topic, and virtually nothing has changed for my family, my street, or my park. There is work going on, but it concentrates people into Clifford Park and into Newmarket train station, which I never use as a result. It concentrates people into South Bay shopping area. So while there may be fewer people congregating at Mass and Cass, there are plenty of people, just as many as there ever were, in the mile around it. The 10th anniversary of the closing of the Long Island Bridge just passed, and the centering of those services in this area is the direct and proximate cause of the damage to Clifford Park and the surrounding area, where needles, drug paraphernalia, and used condoms litter the ground, along with blood, urine, feces, vomit, trash, food waste, and so on. In 2019, there were meetings about rehabbing Clifford Park at the same time as the discussions for the improvements to the Garvey Park in Dorchester. That park was not only planned, but completed, and it's beautiful. I know because my parents live on that street. Every kid should have a park like that. Clifford has had its plans scrapped over and over. The children who were promised a park when they were in kindergarten just started the 5th grade. The Mason School only goes to the 5th grade. Let's be real. The unspoken reason nothing has been done at Clifford is because Mass and Cass has not been sufficiently addressed. Dozens of other parks have been rehabbed. It's all over social media. Activities that have been witnessed and recorded in Clifford include drug use, drug sales, knife fights, altercations with passersby, partial and full nudity, prostitution, and full-blown sex acts while the police watched. The park is a lawless no man's land. And all the city does is post another sign, but not enforce the words written right on it. There's been very little urgency to remediate this situation. We aren't even able to get routine police presence to deter these activities. The only way Clifford Park is going to get better is if someone has the courage to put a halt to the open-air drug market that has been percolating at Mass Ave and Melnia Cass Boulevard since the closing of the bridge. Clifford Park is itself a victim of the opioid crisis. But unlike individuals, it can't be urged into treatment or Section 35'd. It's the ultimate victim of a system that has failed the Black and brown community yet again. In the 90s, this community was torn apart by the war on drugs, where large-scale arrest and incarceration was the norm. There was no mention of recovery, no mention of treatment, and that method was ineffective. But what's going on is now also. The tone has changed with a better understanding that addiction is a disease, not a moral failing. But again, this issue is centered in a majority Black and brown community. and that community bears the burden of society's perception of who is to blame. We are victims too. All conversations are centered on the user community, omitting that the residents and businesses are impacted by every single decision the city makes. This is how Clifford Park has come to be in the state it is in today. Mass and Cass does not exist in a vacuum. Neighbors have no recourse and no financial assistance when their property is stolen and they can't afford to replace it, like bikes or patio cushions, or their vehicles are damaged or broken into, and then their insurance premiums increase as a result. No one thinks of that or of us. Shopping is now customer hostile due to retail thefts. Fences wrap around everything. You can't use a restroom in South Bay most hours of the day. Health and beauty items are in a separate gated section of Stop and Shop or under lock and key at Target. Our park is no longer the welcoming green space it was. How much more is Roxbury going to be asked to shoulder so more affluent zip codes can pretend this is not also their problem? What happened to One Boston? Is that just a convenient hashtag? What's being normalized for Roxbury's kids? That drug users have more rights to the park than they do? That actions have no consequences and accountability doesn't exist? This primarily black and brown community should not be used as Boston's dumping ground for things other neighborhoods don't want and have the political capital and clout to shout down. This is not equity-focused or public health-led, nor is there residential equity, location equity, environmental equity, exercise equity, access equity, or any other kind of equity. In short, it's not fair. Decentralization of services would be a good start in acknowledging that if addiction does not discriminate, then treatment and recovery services don't either. Thank you.
Thank you so much.
Thank you.
Appreciate you. If there's anyone else who would like to provide public testimony, can you just please? Yep. So that's what we're going to do. Yeah. So sorry. So at the same time, also we are going to have a second panel. So I would like to ask the second panel to come and sit down. To come to the chamber, to the floor right now, and as they're coming up, if there's anyone else who is here to public testify, please come to the floor as well. All right. At this time, I'd like to provide an overview of the second set of panelists invited by the committee to testify about some of the businesses and community impacts. I really want to thank all of your patience with the recess and having to reshuffle, but I really appreciate you all being here. So the committee invited Sue Sullivan, who's the Executive Director of New Market Bid, Cheryl Schondeck, who's the Chief Operating Officer for the Greater Boston Food Bank, Ryan Leeming, Vice President Development and Construction of Edens, and then on Zoom, we have Cassie Hurd, Executive Director of the Material Aid and Advocacy Program, and Steve Fox from the South End Forum. For the panelists who are here with us today, I'd like to ask each of you to just state your name for the record, and then please proceed with your opening remarks. I kindly ask that in order to allow time for councilors' questions and discussion, that you please limit your opening statements to 5 minutes per panelist. With that, any of you are open to start. Thank you so much for being here.
Kick it off. You want me to kick it off? Good afternoon. Thanks for having us, and happy to be here. I'm Ryan Leeming. I'm Vice President of Development with Edens. We're the owners of Shopping Bay, or South Bay Shopping Center. And I wanted to thank the last public testimony I heard, because she summed up a lot of the things that I had to say. Obviously, this is an ongoing issue. It's been ongoing since the close of the bridge. I think the encampment order in the last year, as you heard today, has really dispersed the issue. I think as an abutter to Mass and Cass, the shopping center has seen a negative impact. Just simply, since the encampment order in the last year or so, we've seen a significant uptick in loitering. We've seen a significant uptick in altercations, crime as a result, some violence. We've seen a significant uptick in, people looking for refuge, looking to hide or evade, to maybe simply just sleep, just find rest, maybe drug use. all types of other things. As a result of a lot of that, we've had to change how we operate our property. Edens is an organization that prides ourselves on enriching community through our places. We've not been able to really do that at South Bay. We've had to make it a little bit less comfortable. We've had to do simple things like remove furniture, simple things like remove power outlets, simple things like remove access to water, partner with our retail partners to lock bathrooms, as you heard from the last testimony, partner to, in some cases, as a suggestion of the city and our retail partners, institute unaccompanied minor policies. Now, again, that's not a direct correlation to specifically Mass&Cass. There are obviously other things going on in the retail world that caused us to do that. But those are the types of things we've had to do at our property. And as a result of a lot of that, we, as the property owner, have increased our spending at the property by millions of dollars annually. And that's not an exaggeration. Millions of dollars annually in operating costs. We'll take as much overtime as the BPD will give us, right? We'll take it's like we'll do whatever we can to try to enrich community, to try to maintain a safe environment, but we're not experts in that field. We're not experts in public health. I think we know a thing or two about public safety, but we're not experts. We're trying to operate a safe community gathering space, shopping environment, dining environment for the community, and it's been a real challenge to do so. I think a lot of people here said a lot of really important things that I could echo, but in the interest of Sue and everyone else's time up here, I'm happy to stop there. It's been a challenge for us, and I think we've done the best we can, and we've stepped up, and we've enhanced a lot of the programs and a lot of communication with the city, with our retail partners, and try to bring awareness to this. So we're here to continue to bring awareness, help where we can, but it's been a challenge out there, for sure. So thank you.
So I'm Sue Sullivan. I'm the Executive Director of the Newmarket Business Improvement District. And I've been fortunate enough to work in Newmarket and all for 40 years, 30 years as the Executive Director of the Business Association and now the BID. First of all, I need to say how much I admire the businesses and the residents, the employees and all of the Newmarket area and the area around it. For not 2 years, not 5 years, but 10, 12 years, they have borne the brunt of being at ground zero of the opioid addiction and homelessness crisis in the city of Boston. That's not to say that everywhere else doesn't have the issues and problems, but we are at ground zero, and the fact that these businesses and residents have dealt with this on their doorstep for over 10 years is commendable, that the resiliency that they have. And so I so appreciate that. Not to rehash everything, because a lot's been said today, is because I don't want to rehash past, I just want to show where we got to where we are. And as you know, 10 years ago, the bridge to Long Island was closed, the opioid and fentanyl explosion in the area and nationwide. Everything happened, and we had hundreds of people on the connector and on Milnea Cass and all. And we thought that was very bad. And then it continued. It continued for years until it got even worse in 2020 and 2021 when we had 175, 200 tents on Atkinson Street, Southampton Street, all through our food processing businesses, Newmarket Square, okay? So then I give Mayor Wu a lot of credit when she came in 2022, and one of her first acts was to take all those tents down. That was an important step in saying we're going to change things. But the problem is people came back. And by a year from then, we then had another 175, 200 people camped out on Atkinson Street. And that led us to last November, where through a lot of partnerships with city departments, the police, public health, Newmarket, other partners, all the nonprofit partners, they brought about the no tent ordinance in the city of Boston. And it wasn't just Melnia Cass, it was all over the city. And to be honest, that has worked. I know there are people that would say things have gotten worse, you know, in terms of people being in different spaces and trying to find other locations. But you can't have people living in tents and the squalor and all we had down there and elsewhere in the city. It's just, when we talk about inhumane, that's inhumane. Okay, so today you have almost no encampments in the city of Boston, anywhere. They'll pop up, they get taken care of, okay? But that didn't mean that again this summer, we didn't end up having 100 people, 125 people on Melnia Cass, not camping out, but congregating. Most of the people down there through this summer have places to stay. 75% of them were just coming down because they could and needed a place to be. In late August, the city of Boston, the police department said, we're changing up what we're doing. We're not going to let people congregate anymore. We're going to close that down, and the police changed, and Deputy Humphreys talked about the initiative that they've been working on. And that is to keep people moving. Moving to different areas, yes, but to keep people moving. And what I'll tell you is the quality of life in Newmarket increased dramatically because of this. Now, that's not true necessarily in other places. It's true of us, okay? It has made a difference. And for that reason, I have asked that the city and the police continue this initiative through the end of the year. Because while all it is pushing people around, it actually allows people to get greater chances into recovery. It allows our public health department to actually work with people when they're in smaller groups here and there and everywhere, and not in like groups of 20 or 30 or 50. Now what I'm going to say, and by the way, just for context, Newmarket does all of the street cleanup in all of Newmarket area. And since August, we have also do all the trash, not all, but a good portion of the trash and needle pickups in Andrews Square, a large part of the South End, Ramsey Field, and Nubian Square, as well as we do a lot in Pear Square. What I've seen is that in the beginning of this initiative, a number of other neighborhoods surrounding us saw an uptick. But in the last several weeks, the needle pickup numbers in all areas surrounding Newmarket have decreased by almost 50%. So what I'm going to say here now is all that's been what's happened, okay? Enforcement and all is we need a multi-pronged approach to solve this problem. And the city is working on that. As you know, we came out with Recover Boston last year. Newmarket Business Improvement District and the South End Forum brought this out. It is a long-term recovery campus model, and we are working with the city to try to get that into fruition. It's a similar model to what Long Island was meant to be, which Newmarket brought to Mayor Walsh back in 2016. We need that recovery campus. We don't need it 6 years from now. We need it now. So many people have said it today. We need that. We need aggressive enforcement by police. And we also need, as many people have said, we need to have mandatory recovery in lieu of jail sentencing. They need to be given not an ultimatum, but there has to be consequences, and there has to be a reason for the people who don't voluntarily go into recovery to go into recovery. And there are a lot of people who will tell you that, oh, mandatory recovery doesn't work. It only works 50% of the time. Well, I'd certainly like to have 50% of the time, more so than no percent of the time, which is what's happening to the people on the street today.
Thank you, Sue.
Thank you.
Good afternoon. My name is Cheryl Shondeck. I'm the Chief Operating Officer at the Greater Boston Food Bank, where I have proudly served for over a decade. I want to thank you, Councilors Flynn and Santana, for providing the opportunity for today's testimony. The Greater Boston Food Bank, or GBFB, is the largest hunger relief organization in New England and among the largest food banks in the country. We operate in 9 counties in eastern Massachusetts and over 190 cities and towns. As the food bank feeding eastern Massachusetts, GBFB distributes the equivalent of nearly 90 million healthy meals annually through a network of our 600 dedicated food distribution community partners that include food pantries, homeless shelters, human services organization, mobile markets at the K through 12 schools, colleges, community health centers, and senior centers, and about 100 of those partners out of the 600 are within the Boston neighborhoods. Our priority is for the safety of our community, specifically the employees, the volunteers, and the partners who come to the food bank daily. Many of them start work before sunrise to deliver, pick up, or sort food that is distributed to feed over 600,000 people a month across eastern Massachusetts. In recent years, neighborhood challenges that you have heard about today through all of this testimony have disrupted our ability to operate and fulfill our mission to end hunger in eastern Massachusetts. We have spent hundreds of thousands of dollars to ensure the safety of our people, our building, and the free, nutritious food that we distribute. These are funds that we could have used to purchase food for our neighbors facing food insecurity here in Boston and across the region. However, safety incidents impacting our facility and operation have become less frequent in recent months, as you heard from the testimony and from Sue Sullivan. As we monitor this situation daily, we have had the opportunity to spend less on security this year versus last year, based on the fact that there are no encampments in our immediate area and there are fewer people currently obstructing traffic in our immediate neighborhood of South Bay and Atkinson. We know that many factors contribute to changes in our neighborhood safety. We support the collaborative efforts of Mayor Wu's team, the Boston Police Department, as well as our incredible partners at the Newmarket Business Improvement District, specifically that they have contributed to improvement in neighborhood safety around our building. They've added a shuttle service, and they do have additional private security on top of the security that we have at our building 24/7. The Greater Boston Food Bank is incredibly grateful to the City of Boston for addressing these challenges. We will continue to support the city's pursuit of a sustainable plan to ensure stability and safety in our great neighborhood. Thank you for the opportunity to provide the testimony this afternoon.
Thank you so much. We're going to move over to our Zoom. I know we're joined both by Steve Fox and Cassie Hurd. Steve Fox, you have 5 minutes.
Good afternoon. Can you hear me okay?
Yes, we can.
Great. First of all, let me introduce myself. I'm Steve Fox. I chair the South End Forum, which is an umbrella organization for all the neighborhood associations in the South End on issues of common concern across the neighborhood. I also chair the 10-year-old working group on addiction recovery and homelessness, which has been kind of the vehicle that the community has used to gather and to discuss this issue on an ongoing basis with specific focus on the Mass and Cass area. So I wanted to thank Councilor Flynn, Councilor Fernandez-Anderson, and Councilor Santana for holding this hearing. I do want to really tell you how much I appreciate the fact that you're looking at this issue. I'm a little skeptical based on 10 years of experience because we've been here a lot. The members of the community have come to this forum and have come to this discussion for almost 10 years now. And I'm one of those people. Ever since the Long Island Bridge went out, we have been trying to create an opportunity to discuss ways to move the ball forward and to deal with the ongoing addiction, homelessness, and recovery crisis that we're facing. So I don't want to repeat a lot of the commentary that has already been made by several of the very good speakers that have already offered their thoughts. But I want to concentrate on 4 or 5 ideas that I'd really like to be key takeaways as part of my contribution to this hearing. The first is that you've heard a little bit about the fact that we really are hoping that we can see our way forward to concentrating more on a recovery modality rather than a harm reduction one. When we came to this issue 10 years ago, harm reduction and housing were the key issues that needed to get managed, and they have been managed. And I think that there's been a lot of progress. But what has been missing has been a concentration on recovery and on recovery programs. And even today, you can talk to outreach workers or you can talk to neighborhood people, and they will tell you that it will take them 2, 3, sometimes 4 days to try to find an appropriate space or a program for someone who wants to enter recovery to get into. And that's just unacceptable. That kind of takes me to where we are today in terms of the Mass and Cass and Atkinson area. I know Sue Sullivan, who's been my partner in all of this for the past 10 years, talked about the improvement that has gone on at Atkinson Street, and there's no question in anybody's mind but that Atkinson Street was a public safety hazard that needed to get addressed. And the tent ordinance was one of the vehicles that was used in order to address that issue. And it was a good thing. But what we predicted before the tents were removed was exactly what has happened, which is that everybody and the activity and the drug dealing and the use and the encampments have migrated from Newmarket into South End, Roxbury, Dorchester, South Boston. What we knew was going to happen actually happened. And so it's a little disappointing that while we recognized what needed to happen was in terms of creating opportunities for recovery was not addressed. Just removing the tents and placing fixed posts at Newmarket drove everybody into our neighborhoods. And that's what we, in the neighborhoods, in the South End and all the other neighborhoods that I've mentioned, are now seeing on a day-to-day basis. The activity we're seeing in the Southwest Corridor, which is, far and away the most active area because it's a green space, is enormous. I mean, we've seen encampments on a day-to-day basis in the Southwest Corridor that we never saw prior to the tents. Of the tent removal successful because it didn't address where people were moving. And so I want to make sure that we address the issue of dissipation of people into the other neighborhoods and how that has become a crisis for all of us. So moving people from Atkinson may have been successful and may have helped to alleviate the problems that the Newmarket business community has seen, but it sure hasn't helped our neighborhoods. Second issue, when issues are discussed in terms of strategies or initiatives, what's really important is to bring community members to the table. And the CRT, which is the internal team, the combined response team, meets on a weekly basis. There is no community representative at that. We've asked on a number of occasions to create an opportunity for people like Sue Sullivan or myself or others from the community to be able to speak and to talk about our concerns and to offer our ideas. We had to do that when Sue and I proposed Recover Boston in terms of providing an opportunity for us to create a recovery modality that was in anticipation of Long Island. And I'll just make one mention of Long Island, which I think is important because it hasn't been mentioned thus far. We're not feeling really good about any progress being made in terms of the Long Island facility. We don't see any effort to shore up the buildings, to create an opportunity for the buildings to actually become usable. We know we're waiting for just the final ink to dry on the Quincy suit in terms of the bridge rebuild. We're not seeing staging in terms of creating the necessary infrastructure to recreate the bridge. So it feels as though Long Island is in suspended animation and that nothing is happening in terms of moving us forward. And so that's why Recover Boston as a treatment recovery modality is so important. So I know I've taken up a lot of time, but I wanted to be sure that you understood that we are very appreciative of the provider community, what they have done, what the city has done in terms of the public health folks. But in some, we have been doing Band-Aids for the past 10 years. And every year we come together and we talk about this crisis and we fail to finally embrace a strategic plan that addresses the long-term issue that we have been facing for the past decade. I'm hoping that this hearing will be the linchpin for allowing us to move us into a modality where we're actually willing to dedicate the resources to make a strategic plan to address this rather than as a Band-Aid. Thank you.
Thank you, Steve. Cassie Hurd, you have 5 minutes.
Hello, thanks for having me. My name is Cassie Hurd. I'm the director of the Material Aid and Advocacy Program, or MAP. I've been offering support to, learning from, and organizing alongside unhoused community members and people who use drugs in Greater Boston since 2006. Thanks to Councilor Fernandez-Anderson and Flynn and the committee chair Santana. We offer low barrier drop-in space for unhoused community members, engage in outreach and sweep support, and organize alongside our members for their individual goals and needs and for systemic change. Every day, our community members experience the impact of, systemic racism, systems failure, and many of the policy choices, including those that have been made by folks in this room, and are forced to move between cities and neighborhoods. As many folks have noted in this hearing, people are being shuffled along I would counter Sue's statement that it is actually good for people to be forced to move along all day. People are using drugs in more chaotic ways in order to stay up to be able to move. People are getting less sleep. I think we would all argue that sleep is important and crucial for our mental health. And it is causing people to behave in more erratic ways. And I think a lot of the observations that have been shared are about people's behavior and not people. And that behavior is because of harmful policy and practices. As others have noted, it's been 10 years since the haphazard closure of Long Island and nearly 1 year since the camping ban. And to remind the council, which this council co-signed, and the quality of life and public safety issues that are being brought forward are the effects of leadership spanning 3 mayoral administrations choosing to invest in these carceral strategies that really just sort of yes, we absolutely should all have an urgency and be uncomfortable with people surviving on the street. But these policies have just I've heard other folks all throughout this hearing, it's been the illusion of a resolution, right? People are moved from one block to the next. A transitional housing site has popped up, but there's no permanent housing on the other side of it. People are fighting to survive every day, and their safety is decreased in having to fight for that survival and being in consistent crisis. I think something I just want to note is the premise of this hearing is fraught as it focuses on the cumulative side effects of the city-created humanitarian crisis and the impacts on housed people and businesses, but not on the impacts these policies are having on unhoused community members who are, to be very clear, the most impacted people. I want to push back a bit on what I've heard people share of that folks are service resistant. We are all unique beings and there's not a one-size-fits-all approach. Services don't necessarily meet everyone's needs, right? And what is increasingly true in Boston, and what we have heard is the strategy of the coordinated response team, is that they're moving people along. And what we have seen is that there has been a strategic divestment from specific services that have actually been really effective in both working for people and also just meeting the broader community's needs, right? Of the engagement center had bathrooms. People were not having to go to the bathroom in the street, right? I just think if this meeting was configured in a different way, and if we had a different approach, we were listening to unhoused people who use drugs, who should be leading this conversation, we would be in a very different place. I want to say, contrary to the misinformed and biased opinions that have been shared, people do know what they need and they know what's best for them. It's perhaps not always available to them. And people are making the best choices with the limited resources that are available to them. People support each other. People are responding to even more overdoses because they are being put into neighborhoods, pushed into alleys that folks have shared. People are sharing they're seeing folks on the sidewalks in the neighborhoods where they hadn't before. Because as much as people should never have been pushed into the Mass and Cass area in the first place and kettled where conflict increased, just pushing people out isn't a solution. I think something this hearing order reaffirms is that it feels like many people in this space aren't able to acknowledge is that criminalization and coercion do not solve homelessness or chaotic substance use or any sort of substance use. And they're actually counterproductive and cause harm, most notably to people who use drugs. And I think something that this hearing order also makes clear to me, and I think perhaps other folks have shared and maybe not thinking about it in this way, is that decentralization is ineffective. I think we do need to acknowledge that there are institutions and organizations that are always going to be in the Mass and Cass area. Boston Medical Center is not something we can decentralize, right? It is our city and region safety net hospital. Boston Healthcare for the Homeless is not moving. The city's 2 shelters one of them a retrofitted sign building, right? Like we are not finding other locations for these. And as Dr. Ojikutu shared, like people are returning to come for services. I am and, you know, was extremely disheartened, and I think it's egregious to learn that the Wood administration is going to choose to once again double down on criminalization through their coordinated response team. But I am hopeful that this body will learn from what I view as a grave mistake of authorizing the camping ban, and take it upon the body, the council as a body, to really consider in a meaningful way evidence-based solutions that meet people's needs and thus would then meet the broader needs of the community, many of which have been brought forward by Dr. Ojikutu, who is, to remind everyone, the city's appointed public health leader. I just want to take a few moments to share some of the strategies that the city is currently using, most of which fall under coercion or criminalization, and the impacts they are having on unhoused community members. As the hearing order notes, you know, the tents are gone, but people remain. And I think while surviving in a tent is by no means anyone's ideal living situation.
Cassie, your 5-minute interrupt. Can you just wrap up the last few things you want to say here? Thank you.
Yes. You know, people have not been offered, there is not enough shelter for folks, right? And doesn't meet their needs. Things as simple as like we are divesting from things that support everyone. The sidewalks being blocked off, both is not ADA compliant and is pushing people to walk in the street. Our community members are being hit by cars. Like this, we need to rethink the approach we have. And I hope this body, you know, instead of co-signing on further policy that will harm community members, including all of us, but most importantly, unhoused people who use drugs, and just have us here again in another year. As Steve said, like we come year after year and this problem persists. And I think we need to look at evidence-based solutions and what people's self-identified needs are. Thank you.
Thank you, Cassie, and thank you for our panelists here. I'm also sorry, I don't want to cut anyone off. I just want to move things along, given that there's another hearing after this one. So with that, Councillor Flynn, you have the floor.
Thank you, Mr. Chair. And Mr. Chair, thank you for giving everybody a fair and equal opportunity to speak this afternoon, whether we agree with people or disagree with them, but you've been very fair in giving everybody an opportunity to speak. So I just want to say thank you. I do want to ask a question for Steve Fox. I believe Steve is still on video. Steve, thank you for your testimony. Steve, tell us the impact that this crisis is having on residents throughout the South End, their quality of life, their family. What are you hearing from residents and how is it impacting them?
Thank you, Councillor. You know, I could actually start by referring everybody to the front page of today's Boston Globe. And I think they had a chart, a couple of charts, as a matter of fact, that talked about the intersections of the city with the most pedestrian fatalities and with the most problems associated with roads and intersections. And the two top collision intersections in the city from 2014 to today are Mass and Cass, and the second is Mass and Albany, right side by side. So that tells you something about the nature of the quality of life, just in terms of people feeling safe and people feeling like it's okay to be able to cross the street and to participate in activities within their neighborhood. I will tell you that, as I referred to before, the Southwest Corridor has become a major problem area for us on a day-to-day basis, both with encampments as well as needle detritus, as well as people who are clearly in need of resources, who are hanging out. And contrary, am I still on?
Yes,
Yeah?
Steve, you're still on.
Oh, okay, thanks. Contrary to the statistics that we've been hearing, I'm getting more and more complaints about needles, about detritus within our parks and playgrounds. So what that tells you is that there's more migration of activity into the neighborhoods, into the parks, into small pocket parks that typically used to be relatively safe and free of lots of drug dealing and activity. So I'm seeing an uptick in terms of commentary from neighbors and neighborhoods about activity that has migrated from the Massancas area into the South End.
Thank you, Stephen. Maybe I'll ask a question to Ryan. I live just down the road a little bit from South Bay Mall near Andrew Station, Andrew Square in South Boston. I also noticed the large drug trafficking in and out of the South Bay Mall area, the Andrew Station area, Andrew Square area. But as a business owner, you highlighted that you're spending literally millions of dollars on public safety, on security-related issues. Is there a point that your boss, that's the CEO, adds up the figures of how much money you're spending on public safety? Is there a point where you say, we can only take this for so long, and then at some point we have to consider closing because of our profit margin is not there, we're spending so much on security, we're concerned about our staff, we're concerned about our customers' safety as well? What are your thoughts, Ryan?
There we go.
Yeah.
I didn't get into that in my opening remarks, but it's absolutely a topic of conversation given everything we've seen up there around the South Bay property. I think eyes are already on those types of things and on that spending and on those budget line items. And not to say we are a Boston-based company, but not to say that it's at this extreme yet. But there has been talk of, maybe we shouldn't continue to invest in South Bay until some of these things get fixed, until we can kind of clear this hurdle. Maybe we should, try to keep doing what we're doing, work with our partners, work with our retail partners, do everything we can to address the issues at our property. But until there's a bigger step or a big something else, maybe we put some additional investment on hold, whether through development improvements, significant capital improvements, etc. Those things do come up. That's the truth. Those things are said. But we're trying to do everything we can to maintain a lot of our retailers. I think a lot of our retailers have been great partners. I think they get it. I think they've been there for a long time. Mm-hmm. They're not, blind to operating in an urban environment, but this is a new challenge, especially in the last year or so. We've seen an uptick in all the things I mentioned. So we're not there yet, but that is being discussed, that is being thought about. It's a very real topic of the conversation.
Your company has been a good neighbor to the city of Boston, to the residents of Boston.
Thank you.
you hire a lot of people, you enable them to have a job so that they can support their family with a good wage. For your employees there, are they concerned about coming to work and the impact it has on them in terms of their safety?
Yep, 100%. Yep, we hear it all the time from our retailers that they have staffing issues. Sometimes they're unable to fill positions because people don't want to work at South Bay because of the negative perception, the safety. Again, not just mass and cast related, obviously. But yeah, that's absolutely something we hear from our retailers. Those you live close by, those that shop at South Bay regularly, you know, they've definitely seen a turnover of stores. You know, the new expansion, what we call District Ave, it's been open for about 5 years. There's housing, there's restaurants. It's meant to be a lot, you know, it was meant to be a lively place for the community to really come. We've shied away from continuing to invest in large-scale events just because of this, right? We've basically said, no more events at South Bay, no more large events, no more, whether it's Oktoberfest or whatever, nonprofit sponsorships, whatever it may be, those big type of, you know, community gathering events that our company is so passionate about, we don't do them at South Bay anymore because of this. So absolutely, on the staffing, we definitely hear that. We have seen some closures and some turnover. I think, again, not all related to mass and cast, but this doesn't help. It doesn't help us in sort of the long-term vision to continuing to invest in that property and continuing to invest in the neighborhood, really, in the community. So, thank you.
Thank you. Maybe I have one more question, and it's relating to what we just talked about. You have a lot of senior citizens also in and around the South Bay Mall that go to South Bay for food, for food shopping. That's the only place that they can get to. Many of them don't have transportation, unfortunately. Are you also hearing from customers as well about them feeling somewhat unsafe when they come to the mall to do their shopping so that they can put some food on the table? What are the customers saying?
Yeah, absolutely. They're all saying the same thing. I think, you know, the woman who spoke before our panel, I think summed up a lot of what the perception or what the experience is for customers coming to South Bay at different times, which is, you know, if it's a family with children and the child has to go to the bathroom, it's sometimes a chore to get into a bathroom at some of these stores just because of the safety issue. So our retailers have chosen to secure them, right? So it's not as simple, it's not as approachable, not as accessible. Definite uptick. I mean, obviously there was an event that happened there last night that we're all aware of. The individual is fine and recovering, but that was at Stop and Shop. And you know, the uptick in altercations, in just whether it's just verbal or it escalates, is there. So there's definitely an unsafe or a feeling or a perception of a more unsafe environment as a result, and customers definitely feel that. I think I hear from folks, friends that live in Dorchester that have lived there for a long time, you know, they go to South Bay because it is so convenient and it's so well located, and they go and they kind of know what they're signing up for in a way, and they try to get in and get out, get what they need, and move on. And it's unfortunate for us, you know, people aren't hanging out, they're not dwelling, they're not gathering for the right reasons.
Thank you. I don't have any more questions for the panelists, but I just want to highlight the critical role businesses play in and around that area. They hire thousands of people. They need the support of the city of Boston, the state of Massachusetts, and the federal government, I believe. Over the summer, as you probably know, I represent a large Asian community, the largest Asian community in Boston. Many of the Chinese residents in my district, unfortunately, when there's a when there is a death, they use the funeral home right near, right in Roxbury, right off of Melnia Cass there. There's a Asian-owned funeral home, as you probably know. Residents expressed to me their concern over the summertime about using that funeral home, about visiting a loved one that unfortunately passed away, asking me, is it a safe area behind Melnia Cass? But we need to do a better, I guess my point is, we need to do a better job of providing public safety resources and support, neighborhood services to residents certainly, and to businesses as well. Because businesses aren't the problem, businesses are part of the solution in providing quality of life and public safety support should be our #1 priority. I love that area in Roxbury, but after that Melnia Cass closed down, a lot of the people went from Melnia Cass into that Roxbury area, right where Suffolk Construction is as well. Thank you, Mr. Chair.
Thank you, Councilor Flynn. I do have a few follow-up questions, and really appreciate, Ryan, you answering Councilor Flynn's questions. I do live very close to South Bay Mall, about 5 minutes, but we'll want to hear from our other panelists and also on the Zoom, if whoever wants to chime in, about our workers, right? What they're experiencing. Ryan, you mentioned, the safety of the people who are coming into our businesses, but also our workers. And I know some of you touched on it. Can you just speak to more about that? What has leadership have to do in order to either train or to try to avoid certain situations with the public safety in regards to our workers?
Yeah, so do you want to start and then I'll...
Sure. So at the food bank, I think we have invested in a security company 24/7. We also provide quarterly updates to the team. Folks have contacted us based on what happened yesterday at the South Bay Plaza. We continue to say, be aware of your surroundings and utilize the shuttle system that the Newmarket Business Association had set up that takes folks from our building to Andrews. But it is just creating that awareness. We train them on the 311, and the use of the 311 has been very helpful, as well as having that phone number for the security that we hire 24/7 for the team.
Sure, and just a quick follow-up. For the food bank, do you do any youth programming that you
You do have to be 16 years old to volunteer at the food bank. So anyone under 16, we, don't say.
I still consider 16-year-olds, there are youth.
They
right?
are.
So
They are.
Do you have to do any specific outreach when you have youth coming in? Or do you partner with
We do the same
schools?
outreach with the volunteers as we do with our team. Okay. So that security is there. We have free parking diagonally across the street from our front door. You get an escort to the front door. And we try to, as I mentioned, we look at people safety, building safety, and food safety. And we are willing to make that investment to support the mission.
Thank you.
Thank you.
So just to add on to what Cheryl was saying, as the director of the bid, I represent 650 property owners, 575 businesses, and 20,000 employees and several thousand residents. And, I get on a daily basis all the calls, everything that comes in. We have our round-the-clock security that is responding to, on average, 200, 300 calls a day, okay? And from all of this. So to say, we do have issues. We have, significant all day, every day. But I guess what my thing is, and Marla is one of my residents, and Edens is another one of my stakeholders, and Wing Fook Funeral Home is another. And as we're moving people, the problem is that if we're moving people from one area or another, they're going to go somewhere else. And we're trying to get them into recovery. The city's trying to get them into different places, but where do they go unless you ensure they can no longer be on the street? You know, we have struggled with this now for 10 years. And I think everybody says we've got to change it, but people say how. You know, if you talk to Steve Fox and I and others who were today, we need the long-term recovery campus. We need it now. You know, I know this isn't your question per se, but I'm a little disappointed that we're sitting here in a hearing room, and I so appreciate the two of you being here and having us on this panel and all. But this is something everyone should be talking about. Everyone should be here trying to figure out what is the solution, because it's not just us. It's Denver, it's Seattle, it's Portland, it's Baltimore, it's San Francisco. And I don't want to point fingers and say we're better than they are, or we do this better. There are a lot of things we're doing that are good, but there's a lot of things that need to be done. And I don't want to go on, but I Recover Boston, you know, Recovery Campus, we're going to be pushing it. So.
No, absolutely, and really appreciate your partnership on this, and we'll continue to work on this issue on the council. So, you know, those are my questions. I don't know if any Steve or Cassie, if you have anything else to say on the Zoom before we wrap up. I know we do have public testimony that I do want to get into that they've been waiting for many hours for, but just want to give an opportunity to first our Councilor Flynn and then any of our panelists right now, if you have any closing remarks or anything you want to make sure that gets into the record.
I do want to take the opportunity. I know Andy Brand of the South End would like to testify, and want to see if we can give him a couple of minutes, if that's okay.
Yeah, absolutely. Central staff, Ethan, if we can just put in Andy, who has been waiting patiently to testify. We will get them up and going right now.
Okay, thank you. All right, so I'll keep to my 2 minutes. I supported last year's efforts to remove the tent, but at the time warned that without a treatment plan such as Recover Boston, we would simply move public safety issues into the neighborhoods. And that's exactly what happened. We've seen a dramatic increase in drug use, package theft, public defecation, needles, and other biohazards. It's worse than it's ever been. I've been fined when addicts tore apart my garbage I left overnight, and twice I was not able to take garbage out at 5:45 a.m. because addicts were on my stoop, and it's dangerous to ask them to leave. So I just held the garbage and waited for the next pickup. I'm asking you to take short and long-term actions to address these issues. Short-term, increase police presence, and bike patrols are especially effective. And aggressively enforce the laws against drug activity, trespassing, package theft, and other minor crimes. Longer term, please aggressively support Senator Collins' MIT and Navy validated plan to convert a decommissioned ship into a floating hospital. That ship could be used to house Recover Boston and provide temporary housing and comprehensive services to those battling addiction and other mental health issues. It would create a secure and supportive environment for recovery, reduce the strain on our neighborhood, and improve public safety. It would cost less than half that of Long Island Bridge and would be paid for by the money from the opiate settlement. And most importantly, it could be implemented in weeks, not years. Several West Coast cities have moved from a housing first to a treatment first approach. They recognize that long-term recovery and stability requires comprehensive treatment that addresses the root causes of addiction and mental health disorders. Recover Boston will ensure that individuals get the treatment and support to overcome their challenges, leading to better outcomes for the individuals and the community. We need a collaborative effort between the city, law enforcement, and community organizations to effectively address these issues and restore a sense of safety and security to our neighborhoods.
Thank you so much. I believe we have 2 more people who want to testify on Zoom. If you can just introduce yourselves and unmute yourself, and then you'll have 2 minutes.
Can you hear me? Sorry.
Yep, we can hear you.
All right. Perfect. Okay. You can hear me, but can you see me? Okay, there we go. Am I correct?
We can hear you, so you can go ahead. We can't see you, but we can hear you.
All right. Don't know why.
Oh, we can see you now.
Okay, perfect. I was there earlier in person, but the evacuation. All right. I won't waste any more time. I'll just get straight to it. My name's April Carmine, and I've been a resident of the Leather District for the past 13 years. My husband has been a resident of the Leather District for 20 years, and we have a son who attends a BPS school. I am testifying on behalf of myself and my neighbors to express our growing concern regarding the lack of public safety in our community. We are witnessing an alarming rise in drug addiction, dirty needles, drug dealing, theft, and violent incidents like stabbings. The unfortunate consequences of the former Mayor Marty Walsh's decision to demolish the Long Island Bridge without a rebuild, and with it, the Treatment and Recovery Service Center, have left many people who suffer from substance abuse disorders struggling to find adequate treatment options. Without a proper support, they have returned to the city and faced overwhelming temptations to use again, while drug dealers have preyed on their vulnerability. To make matters worse, Mayor Wu's decision to dismantle the mass and cast encampments, while well-intentioned, has not resolved the issue. It has only spread the problem into our neighborhoods. As a mother, it infuriates me to see addicts shooting up in broad daylight. I have videos of proof of that happening. As I walk my 12-year-old son to school, I find myself taking countless photos of dirty needles and report it to 311. It's been a great tool to use, but why should I have to do that? I am angered not just by what I witness, but by the lack of real action from the city to address the root of this issue. We need more policing. We need officers who can arrest and confiscate drugs from dealers. Who are the ones who are sustaining this crisis? Dealers must face prosecution with serious consequences, including hefty bail sentences. No more no cash bail. At the same time, we need more treatment centers for those struggling with addiction. I was unaware of this cruise ship idea, and I am all for it. If that's what's going to happen right away, instead of talking about something that happens 3 years down the road, do it. But none of this can happen without more police officers. The current numbers of officers is insignificant to meet this urgent need for public safety and to tackle the drug crisis effectively. Every day, my neighbors and I receive citizen app alerts about stabbings and thefts in our area. We frequently call 911 for issues ranging from car break-ins to finding addicts on our doorsteps, unsure if they've overdosed. Some yell at us as they go through drug-induced episodes. We're empathetic, but this is not a livable situation for our community, and it's certainly not a safe environment for our children. Our quality of life and mental health are deteriorating. We should not be afraid to walk our dogs, take our children to the park, or just go for a walk on our own through the neighborhood. I recently had a conversation with a police officer after making a 911 call. He shared a troubling story. A friend of his, originally from Boston, but now a trained officer in Georgia, wanted to return home and serve his city. However, due to the residency requirement, he was denied the opportunity to apply until he met that requirement. This policy is absurd. We have qualified, eager officers who want to serve, and we're turning them away. Boston's police hiring procedures must be reformed. We can't afford to pass over good candidates when we are in desperate need of more officers right now. Public safety should be the top priority for any city, and yet Boston feels like it's slipping into chaos. I feel for the safety for my son, my husband, my neighbors, and our local businesses. This cannot become our new normal. If we don't address it now, the problem will only get worse, and lives will be lost. I refuse to accept this, and you shouldn't either. I implore you to take the immediate action to increase public safety by hiring more police officers. The time to act is now. I also want to express my gratitude to my district's counselor, Councilor Flynn, for his tireless advocacy on this crucial issue. He has always responded when we have expressed our concerns, and we greatly appreciate the neighborhood walkthroughs he attends with us and hearing our concerns. That's all I have for now.
Thank you so much. Really appreciate you hopping back on virtual. I know you were in here in person earlier, so appreciate your flexibility and your patience. I believe we have one more individual who has signed up for to testify virtually. If you can just state your name, and then you'll have 2 minutes to testify.
Can you hear me?
Yep, we can hear you, Steve.
Okay, but you can't see me, and I don't have any. Oh, I see.
Oh, we just had you. Oh,
Yeah,
there we
okay.
go. We can
Finally
hear you,
figured it out. And I see Steve Fox is smiling, so that's good. He and I know each other quite well. So I have lost what I was going to do here, because you covered me. Oh no! Oh, there it is. Thank you for conducting the hearing. I appreciate it. I am in Councilor Flynn's district, and I also want to thank Jacob DeBelcourt, Director of Public Policy, Councilor Fernandez Anderson, for his help in preparing for this. Very quickly, 2007, the Long Island Bridge was determined to be in such bad condition, Mayor Menino reduced traffic to one lane and restricted its use. Then in 2014, as everybody knows, Mayor Walsh closed the bridge with no plan of what to do with the fallout from that. So the Long Island Bridge has known needed repairs for 17 years. In the August 16th issue of the Boston Guardian, there was an article titled "Council to Address Wu's Drug Failures." And there was this following statement: in terms of large-scale drug rehabilitation plans, the only relief on the horizon is the reopening of the Long Island campus. Oops, sorry. This past spring, there was a preliminary positive determination for the city of Boston for the required Chapter 91 license. This was the last issue in contention for the repair of the bridge. However, the hearing officer has not yet issued the permit. After that, once that permit is issued, the Coast Guard then will have to issue its permit. Apparently, the Coast Guard has already given its verbal approval. So two questions on the table, and I don't expect an answer now. Who will follow up with the hearing officer to determine when the Chapter 91 permit will be issued? And two, who will work with the Coast Guard to urge them to place a high priority on their permit. The question of how long will it take to repair the bridge? The standard answer is 5 to 7 years. That would be a total of 24 to 26 years with a known serious problem of that bridge. As mentioned previously, if the only relief is the reopening of the Long Island campus, then this is not an acceptable time frame. Is Jacob still there?
They are not in the chamber right now, but I will make sure to pass your message to them.
No. What I had asked him to do was, I had my handouts, and I don't know whether he handed them out, but I included a picture of a cable-stayed bridge over the Penobscot River in Maine. It was designed and completed in fewer than 4 years. This is a cable-stayed bridge designed and completed in fewer than 4 years. The design of the Long Island Bridge has been completed years ago, so the design is already done. The bridge supports remain there, hence it reduces the challenge of repairing the bridge. A new deck needs to be installed. Once the permits are done, an RFP could be quickly issued. The city has some ways that it can accelerate the rebuilding, the repair of that bridge. They could contract with 2 firms, one working from each side, which is what Maine did to put up their cable-stayed bridge in a short period of time. And understand, theirs was fewer than 4 years from design to building. The design of this bridge has already been done. The city also could include a carrot and a stick into the contract, and there are other creative ways to accelerate repair to keep it under 2 years. And I really believe they can be done under 2 years. The bridge was reclosed.
Steve, if we can use 2 minutes up, so I do want to give you an opportunity to finish up, but if we can use the 2 minutes are up, so if we can just finish up with your testimony.
I'll go real fast.
Thank you.
The bridge was closed at the recommendation of the state. What role does the state have in the repair of the bridge after 17 years? How much has the absence of the Long Island Rehabilitation Facility cost the city in lives and dollars for the last 10 years? Based on what I've heard, it's cost a lot of money. How much more will it cost if the bridge would take 5 to 7 years? Boston cannot go without another facility for that long. If the best relief is the reopening of the Long Island campus, then the city should not spend any more energy, time, or money on alternatives, in my opinion. Boston needs to develop a sense of urgency to get the bridge open as quickly as possible. It would be nice to designate a lead person, much like a Philip Eng, whose sole responsibility is to get the bridge operational. And the state must come to the table. My last comment is, if you haven't read Rough Sleepers, it gives you an education of what homelessness and addiction is. Dr. Jim O'Connell knew the abstract truths about American hopelessness, that is the direst form of poverty, that it consigns people to appalling miseries and kills them well before their time. Thank you for taking the time.
Thank you, Steve, and I just want to note that we did receive your picture, so thank you so much for sending that over. With that, I do want to thank all our public testimony, people who came in and testified, our panelists. I do want to just turn it over back to the lead sponsor for closing remarks. Councilor Flynn, you have the floor.
Thank you, Mr. Chair, for chairing this important discussion, giving people an opportunity to be heard, including residents, including businesses, people in the recovery community as well. We have to acknowledge that we have a major crisis facing the impacted neighborhoods in and around Mass and Cass, including obviously the South End and Roxbury and Dorchester and South Boston, but also the Copley area in Back Bay or downtown Boston, in Boston Common as well, other areas near the Boston Garden. but I don't think we're here to place blame on anybody, but we are here to acknowledge we have a serious crisis, and we're all willing to work together to acknowledge the crisis, to advocate for more police on the street. I think we need to ensure that we have a zero tolerance policy, in my opinion, for criminal activity that takes place. Criminal justice reform has to be part of that solution, where people convicted of a crime are sentenced to prison. Residents pay, and business owners as well, pay huge property taxes, and they deserve to live in a neighborhood that's safe and healthy. And same with businesses, that they're able to provide a product or a service to residents, but they want to conduct their business in an environment that's safe and healthy for their customers and their staff as well. My final point, and in conclusion, is it's about working together. No one has all the answers. It's about listening, compromising, working together, in ensuring we provide the residents the best public safety services we can, and quality of life issues as well. Thank you, Mr. Chair.
Thank you, Councilor Flynn. I just want to thank, again, all of our panelists, members of the public, and my colleagues for your participation in today's hearing, and specifically thank Councilor Flynn and Fernandez Anderson for sponsoring this hearing and including me as an original co-sponsor. Thank you so much for being here. This hearing on docket number 1205 is adjourned. Thank you.
Thank you.
Thank you.
Thank you.